So welcome everyone to our 2021 Champion Provider Fellowship Mini College. We'd like to thank you for joining us today. We know that you have many responsibilities, professional and personal, and we realize that you may need to step out during portions of the training. That is okay. Realize that we will be recording the training, so you'll be able to reference that recording later. And slides and handouts will be available on our website under the 2021 Mini College tab. And Alana, I think it's put a link to the chat as you mentioned, so you'll be able to find some materials there. We will not be recording the breakout sessions during lunch that are for the purpose of networking, and also the afternoon sessions for development action planning. So a few housekeeping comments. Just remember to keep yourselves muted during all of the presentations. We'll be moderating the chat box, so you can put all of your questions and comments there, and we will address them during the Q&A portions of each of our sessions. We'll also allow you to unmute yourself during that question and answer time. We are administering an evaluation at the end of the session via Qualtrics, so make sure to complete that. You will get the link emailed to you at 2:30, and that will be to the email address that you provided when you registered. If you don't receive that link, just let us know, let Alana know. We'll also be providing the link in the chat. And for those of you who need CME and CD credits, we'll provide further instructions on how to receive those once you've completed the evaluation. And finally, as we mentioned, although you'll be muted during the presentations, we still want you to engage in the discussion. In addition to the chat, you can use any of the Zoom reaction emojis that some of you have maybe become familiar with over the course of this year, but feel free to use those to engage and use the raise hand function, direct message, or anything to get our attention to pull you into the discussion. So before we move on, I'd just like to again remind everyone to take a moment to update your profile name. We'd like it to include your county. So there are some directions here that you can see, but we'd like you to click on participants in the control panel. Then you'll see a box that pops up with all the names. Find your name. Once you find your name, hover over it, and you can select the rename option and type in your county in addition to your name there. Now for the agenda, this information again is on the website under the Mini College page along with all of the worksheets. But we will be starting out with our works in progress sessions, and we'll have a brief break. We'll move on to remarks from CalFresh Healthy Living and Office of Oral Health, and then we'll have a workshop. There will be a workshop worksheet attached that will be provided to you. And then in the afternoon, we're moving on to our social media training and having our afternoon group work sessions that will also have an attached worksheet that we'll be providing you. A note as well that during lunch, we'll have breakout rooms set aside for networking. There will also be kind of a catch-all networking group. These are really meant to be very informal opportunities to speak with your colleagues, talk about the work you're doing, just get to know each other. We'll offer a few questions that might guide your discussion, but feel free to use these sessions as they seem most beneficial to you. Please make sure, as Alana already mentioned, to use the link in the chat to sign up for a breakout room on the Google Doc, and then we can go ahead and assign those ahead of time to make sure that you're in the room that you're most interested in being in. So all of the speakers today, all of our presenters have no conflicts of interest or relationships to disclose. I'd like to just briefly go over the objectives for today's training. One, we want you to be comfortable articulating the ways in which, as physicians and dentists, you can engage in policy systems and environmental change interventions to improve health of your communities. Two, identify strategies to support personal well-being and resiliency. Three, discuss opportunities for leveraging social media to advance PSC change interventions. And four, develop action steps in collaboration with your local health departments and other stakeholders to advance PSC work. As a reminder, we'd like to encourage you to explore today's conversations and all of the topics that we're talking about through a health equity lens. Since we last had an opportunity to gather as a large group, the country has again been forced to reckon with deep-rooted issues of racism that most recently targeted the Asian American and Pacific Islander community. Racism is a public health issue, and we must continue to dismantle the systems and rhetoric that embolden individuals to act from a position of hate. Efforts to create healthier, more equitable communities will be hindered until we fully address the depth and breadth of racism in our country. I'd also like to remind you again of the website. This is a recurring theme, but we really do want to draw your attention to all of the resources that we have available to you as you move through your fellowship. We've created resources based on the 5 focus areas outlined in the PSE playbook. When you select one of the focus areas, you're able to find an overview of the topic area, information on fellows who are currently doing work in this area, success stories, implementation toolkits, and a slew of other resources, including webinars that we previously hosted. And we really hope that you take advantage of all of that. You can also access all the slides and handouts from our past trainings, webinars. You can find newsletters, and this goes back 4 to 5 years. Under the events, you can also find our updated program calendar through June, and I want to call out a few upcoming events for you to be aware of. So April 27th, the final session for the Persuasive Narrative series, and these have been going extremely well. Thank you to Mike and Muriel for running these so well. On May 4th, we have a webinar. On May 13th, we have a work in progress session, and would be delighted for any new faces to join us. As a reminder, these are fairly informal and a wonderful opportunity as well to network with your co-fellows and find out about the work that they're doing. And June 10th, so there's still room to sign up for the op-ed project that we are excited to be hosting. This is a 1-day training. It will be 8 hours, a long day, but we expect this to be extremely productive, and hopefully you'll be able to craft and turn those wonderful persuasive narratives that you're working on into op-eds as well, and would love to encourage you to take part in this event. It's always extremely well reviewed and well received. The registration is limited to 30 people, so make sure to sign up soon. It's open to all of our fellows, current and previous fellows as well. You can register for the training via the Eventbrite page. And after the training, also important to note that you'll have access to journalist mentors for individual feedback on any op-ed drafts that you start working on during the training. Okay, so on to our first session for today. We'll be kicking off the meeting with our work in progress presentations that will be led by 4 of our Champion Provider Fellows. Before we start, I want to put in another quick plug for the quarterly work in progress series. We encourage all of you to join us, current fellows and past fellows as well. This, again, as I mentioned, is a great opportunity to hear about the work others are involved in, as well as get feedback on your own work. And we've really heard wonderful things about how this has connected people and helped them advance the work that they're currently doing. You don't have to put together a formal presentation, no PowerPoint slides are needed. It's really an informal discussion. If you do want feedback on a formal presentation, we're also available to do that too. So our next session is Thursday, May 13th from 12:15 to 1:15 p.m. and I'll continue to moderate these sessions via Zoom. So here are 4 presenters for today. We will have each presentation last about 10 to 12 minutes. And at the end of all of the presentations, we'll have time for Q&A and discussion. But again, as you're thinking of those questions, feel free to use the chat button to log them. We'll keep track and be able to kind of go back and talk about those questions and bring you into the discussion at the end. So our first presenter is Dr. Mozam Bajwa from Riverside County. Dr. Mozam Bajwa is a family physician and core faculty at Riverside University Health System, UCR, Family Medicine Residency, and he's currently leading the program's Community Health and Social Medicine Initiative. He also directs the Healthy Eating and Lifestyle Promotion HELP program. This is a longitudinal curriculum in which residents, physicians, empower local high school students with skills and resources to advocate for healthy change in their communities. He believes in achieving health equity through community engagement and collaboration, and is currently serving as a principal investigator for 2 interdisciplinary research groups through the Center for Health Disparities Research at UCR School of Medicine, as well as faculty advisor for the UCR Street Medicine Initiative. And with that, I will turn it over to you for our first presentation. Thank you.
Thank you so much, Dr. Samara, and thank you, Elena, for coordinating everything today. I know there's a huge undertaking, just corralling all these physicians and dentists into one Zoom on a Thursday. So very excited to be here. If anybody's having a hard time hearing me and I need to speak up, just mention that in the chat, because I've had some mic issues the last week. But for right now, I'm just excited to share about our work that we're doing in Riverside County around food security. You can go to the next slide, please. So as mentioned by Dr. Samara in the introductions, I'm currently a family physician in Riverside University Health System, which is the county health system for Riverside County. And I held faculty positions at the RUHS Family Medicine Residency Program and the UCR School of Medicine, leading their community health initiatives. And the clinic where I've practiced for the last 3 years is in Moreno Valley, which is a medical shortage area with very high rates of poverty. I also cover inpatient and L&D at our medical center, which is a safety net hospital that serves Riverside County. So prior to my experience with the Champion Provider Fellowship, I had led a program in local high schools to bring health education to students and their families. And so once a month, I take our resident physicians to these schools and we teach strategies around healthy behavior changes for the students, such as motivational interviewing. And that seemed like a perfect existing collaboration to expand my efforts as I began the fellowship. And so I expanded our education and advocacy outreach within the high school partnerships. And we also made plans to formalize a school wellness policy around nutrition with the local school district that we were working with, excuse me. And when initially meeting with my partners at the health department, we also discussed big plans to continue work on a Parks RX existing Champion Provider project that was already going on, which, all of these seemed like reasonable goals at the time. But looking back, I essentially wanted to do everything when I started the fellowship. And I had a hard time narrowing my focus into actionable goals using a PSE model. And it really wasn't until the onset of the COVID-19 pandemic that we shifted our focus towards addressing food insecurity within our clinic. So there was already data about county and city level rates of obesity and food deserts from the different county health assessments that have been done in Riverside County over the years. And those demonstrated that Moreno Valley had higher rates of both obesity and food deserts than state averages. And these areas of food deserts were defined as having more than twice the number of convenience or liquor stores and half as many large chain grocery stores compared to county averages. This map, I think, is pretty helpful. It's from one of the previous county health assessments that shows where exactly these food deserts exist within Western Riverside County. So that's highlighted in red. And then the shaded areas with the lines are showing also the highest rates of obesity. So our clinic, which is at the yellow star here, sits right in the heart of this endemic area. And our current pilot project for screening reflects these same trends, as more than a third of the clinic patients surveyed has screened positive for any food insecurity in the last 12 months, which was even higher than I anticipated it was going to be. But I'll talk about our methods behind that a little bit in a following slide. So by talking to our patients first and getting feedback on their lived experiences with food access, we developed an intervention that was community focused and thus much more likely to succeed and be useful for our patients. We used a validated 2-item screening tool, which is the Hunger Vital Signs. And our initial pilot run was with 2 of the 6 physician teams in our clinic. So it's a residency run clinic. So we have different physician color teams. So this was 2 attendings and 12 resident physicians and 6 nurses who were running the pilot initially. And our intervention currently includes connecting patients with existing food pantries or assistance programs within our area with a point of care brochure and follow-up, and adding them to a list for patients to follow up. But the main intervention that we're setting up is to directly connect patients with fresh produce and shelf-stable food storage that's distributed from within our clinic walls. So I want to take a quick moment just to recognize, the major partners that have guided this process to this point, starting first and foremost with Valerie and Lori and the CalFresh team at RUHS Public Health. Prior to my time with the fellowship, we had already worked together with my residency program's high school outreach initiative. And so her team with the students would share nutrition lessons and provide them hands-on learning at local grocery stores about how to shop for healthy meals on a budget, and just really fantastic curriculum. And we've expanded that work further during the fellowship with their help. And the school district has also been a really valuable partner in that regard. But when it came to addressing specifically food insecurity within our clinic, the RUHS CalFresh team was just instrumental and fantastic in guiding our efforts. And the most impactful connection they fostered was with our local group of farmers, to basically agree to make deliveries of fresh produce boxes at regular intervals to our clinic and medical center. And that critical step wouldn't have been possible at all without their collaboration. Similarly, my existing network of community-based participatory research partners and professional medical societies really helped guide some of the discussions that we had with our patients and key stakeholders. And of course, the Champion Provider Fellowship staff themselves were excellent connecting us with other champion providers from previous cohorts who had done similar work, and local health departments, and also touching base through the works in progress calls to get a sense of how things worked with other counties and their farmers markets or food RX programs. And all of that together, even though there's been bumps in the road as far as implementation, has been tremendously helpful in learning from other people's experiences. So, in the year prior to the pandemic, because of my experiences, having gone to the mini college and being a part of the Champion Provider Fellowship, I had a pretty strong vision and approach to tackling the systems and environmental changes to implement our project. And this was particularly important because, all of the known health disparities with food access just became magnified even greater as the pandemic overtook our county. And this included, things like disruption to our existing network of farmers markets, which, had to be canceled or moved off site. And as physicians, or we've certainly seen how clinical outcomes related to chronic obesity were also highlighted in the past year. And as I took more weeks to cover inpatient COVID units, it wasn't lost on me that the patients that had underlying chronic obesity were at the highest risk for poor outcomes and death. And as heartbreaking as that was to recognize, it also really helped motivate and inform our interventions in a very powerful way. So the initial term of the fellowship, like I mentioned, was focused on the high school advocacy component, as well as the initial attempts at both the Parks RX and school wellness policy changes before we shifted gears. The high school program is still ongoing, and we just held our virtual community health fair in March, where the students had an opportunity to showcase their advocacy work with community partners. It's essentially a mini Champion Provider Fellowship for high school students to come up with their own projects, and they really do incredible work. And I was happy to see that the pandemic didn't change that. In fact, the renewed focus on health disparities that they had this year was very inspiring. And then throughout my time in the fellowship, I met regularly with our CalFresh team, usually once a month, for updates and ideas. And it wasn't until late last year that we shifted our focus entirely to food insecurity because of the pandemic, and just recently completed our test run screening for it in the clinic. And I can't say how grateful I am to my CalFresh team, just to keep me on my toes in terms of regularly reaching out to schedule meetings and check-ins. Even as my clinical demand skyrocketed during COVID, it was really, really helpful to have them meet and touch base and rescope when needed. And they were also, very forward in identifying potential funding partners and grant partners. And we actually have an exciting meeting coming up in a few weeks with one of our bigger managed care partners to discuss exactly that. So the huge elephant in the room, obviously, COVID for all of our projects, and just in a final part here discussing, COVID was the main reason that we shifted to food insecurity in the first place. So that's the first and foremost part of it. The number of patients that we saw who experienced limitations to access or resources was even greater than I would have anticipated at the start of it. And after our pilot screening period, we recognized that over a third of our patients who were surveyed reported some period of food insecurity in the last 12 months, which was alarmingly high. And prior to the pandemic, like I mentioned, we had weekly farmers markets at the medical center, and we had briefly discussed the idea of prescribing food vouchers through WIC to be used at that market. But once it was shut down and moved off site, there was a huge gap to fill. Similarly, one of our largest food pantries in the area lost its owner and manager to COVID. And that was a huge setback in terms of not just sustainable community resources, but sort of the morale of the network and teams that were working within the space. He was a legend within our area, and losing him was just devastating. The local Salvation Army as well had I think an equipment fire at one of their locations nearby that put them out of commission. So it seemed like every month there was a new and increasing need for these food access services. So within our clinic space, we've managed to make some headway. We've secured a refrigerator within our clinic to store the food, which is fantastic. But we're still working on the coordination of deliveries and pickup, as that requires a dedicated staff to coordinate on site. I will say one of the benefits of the shift to virtual work is that I can connect much easier with my community partners via Zoom or Teams, especially during a busy clinic or hospital day. And I also recognize that perhaps because of the pandemic, there is much more motivation on the part of all of our partners to dedicate time and energy to our mission and goals. And that's very uplifting for me, especially during the dark days when you're covering the COVID units and it's very difficult. And then obviously the school district was fantastic in accommodating our health fair in a virtual platform this year, and the students did a really, really wonderful job. So, the things that we had previously shelved, we're now starting to revisit. So it hasn't been all bad news coming out of COVID. And more importantly, I feel much better about my ability to address those, having gone through this iterative process with the Champion Provider Fellowship. And then just as the last slide here, our next steps are obviously to actually bring that food into our clinic for the patients, to set up a system that we can track that and look at data regarding follow through for those who screen positive, and recognize that they did want to receive some information or resources. And we'll be also applying for some more funding in order to dedicate part-time staff to coordinating this process, and that's what our meeting with the managed care team in a few weeks will focus on as well. We also want to share our work both within our community to engage more patients and recruit through social media and advertising, but with a greater network of community organizations through publications of research. And then the two arrows here kind of highlight the places where I think input from the participants today would be most valuable, as far as how to incorporate the screening more efficiently into our clinic workflow, which has been a challenge, and then also identifying other sources of funding research. And thank you very much. I just want to really quickly again acknowledge, Valerie and the RUHS Public Health, CalFresh team, Claudia, Lori. I've been very, very lucky to work with such a passionate and insightful group, and our community, Riverside County, is very lucky to have them. And then obviously a huge shout out to Dr. Samer and Dr. Thompson for their leadership and guidance with the whole Champion Provider Fellowship, as well as Elena for coordinating all the logistics for the fellowship. The experience has definitely improved my confidence and skills, not only in this intervention for food insecurity, but my approach to advocacy and outreach in general. And as somebody who teaches students and residents about these tenets, being able to speak from my lived experience of the fellowship is very, very valuable. So thank you guys so much. And thank you everybody for listening to my presentation.
Thank you. Thanks so much for that wonderful presentation, Mozam. And as a reminder, we'll have some time for Q&A at the end, but feel free to write your questions in the chat now as you're thinking of them. So for our second presenter is Dr. Melanie Thompson. Dr. Thompson is a family medicine physician and serves as the regional medical director in San Rafael for the Marin Community Clinics. Dr. Thompson received her degree from Touro University College of Osteopathic Medicine and completed a residency in family medicine at the University of California, San Francisco, Fresno campus. She has also served as a behavior therapist and family support worker in the area of child abuse prevention. Dr. Thompson has a special interest in treating the entire family and has particular interest in wellness, meditation, diabetes prevention, and medical education. With that, I'll turn it over to you, Melanie.
Great, thank you so much for that introduction, and thank you for letting me be here. I think like everybody, our lives have all been impacted by COVID, and it's nice to take a little bit of a break and talk about something different. And so I'm going to talk a little bit about our work with the Parks prescription, and I certainly have the fortune of having two of my other colleagues who were also Champion Provider Fellows in the cohort before me, and so we've all just come together to try and continue this work. Next slide, please. So a little bit about me just in terms of my role here in Marin. The Marin Community Clinics is a federally qualified health center. We serve approximately 38,000 patients who are primarily from a Latinx population. I think lots of times when people hear Marin, they think of a very affluent county, and that is true. It is also one of the counties that has some of the worst health disparities. So, you know, Marin County gets the Robert Wood Foundation Award for the healthiest county, and then we know within just a 2-mile radius that the life expectancy for some of our population is reduced significantly. And so, you know, with that in mind, that's sort of, you know, what brought me to the fellowship and really wanting to bridge that relationship with our Department of Public Health and expand our role within the community. So the Canal District does have a population of about 11,000. It's the youngest, one of the youngest populations relative to Marin County. So 28% of our population is greater than 60 years of age. And then when you come into the Canal District, it's a much younger population. And that was significant in terms of rolling out COVID vaccination and testing. There's one park in the canal, and it does have a library within the park. The population, 36% of the population is obese, and 57% of the population is living in poverty. Next slide, please. So we had started the parks prescription, and we were doing some of that work and outreaching to our patients and getting them to the parks. But, you know, sort of big picture, thinking about the county as a whole, we really wanted to expand that reach and also partner up with our Department of Public Health and take some of that burden off of us so that as a clinic, we weren't the only ones trying to get the community into the parks. And so one of the things that we thought about is identifying the transportation barriers that our patients were experiencing and looking to see if we could establish some dedicated park routes with our Marin Transit. And so this is actually from the CHIP that Marin County had done in 2018 and identifying some of the barriers for our population in participating in physical activity. And so transportation was definitely listed as a barrier, and we see that as well for our patients coming into clinic. On the flip side, knowing that, you know, greater than 30% of the population is over 60, we also were thinking about outreaching to those folks who also may not get to the park and may not know how to operate the bus and get outside in nature. So we kind of had these two groups that we were thinking about: our young population of families, and then our older population who might feel quite isolated, and how do we get them all to the park and just let them experience nature. The other thing we wanted to look at is some of our local parks, so both Marin County and city parks, and see if we could help educate the community around those parks. And some of our work early on was bringing families to the park and then setting up activities. And then one of the things we found is we really didn't want people coming just for activities. We really wanted to help educate people about just coming to the park and enjoying the park and, you know, not needing a specific activity. So our early work, we kind of talked about it being like a circus. We had all of these things going on. And so, you know, we kind of took a step back, again, with the idea that we could give information about the parks and then have people just go to the parks and enjoy them and find the activities that they can do at the parks. And then the other thing in partnership with our Department of Public Health was looking at some of these prior transportation routes to see if they could be reestablished. So at some point, I was told we had some dedicated routes that really took people to the parks. And so wanting to explore that and see if we could get those reestablished, even if it was a small number of people that were utilizing them to start. Next slide, please. So again, the Health Equity Initiative was done in 2018 to look at disparities, a wide group of community-based partners that participated in that. And one of the things with our clinic is looking at pediatric obesity. And we know that within the Latino population, physical activity is decreased when compared to other ethnic groups. So we had some ideas about sending people home with a parks prescription. And I know at one of the other talks I gave came to, somebody had been able to implement that into their EHR. So we had been working on that and then sending folks out with a Parks prescription to get them to go. Again, we started in 2019. There was a Marin Transit app that we had started piloting to see if we could get people signed up on the app and get a free ride to the park. That app is no longer available. And so, it sort of transitioned over to using Uber. And so we'll be looking at that in the future. And then we had started to look at the timing of the bus routes heading into the end of 2020. And of course, we know COVID hit. And then within our Department of Public Health, there had been some change with the program manager. And so the program manager came on in late 2019, and we're hoping to revamp our Parks prescription soon. So obviously with the Parks prescription, COVID came, and when you close the parks, that really does put a hold on any of your projects that you're going to do. So public transportation limited, we can't get people on any bus routes. The parks were closed for quite a while in this area. And I think I shared with, one of my first phone calls actually to our deputy public health officer when they were closing the parks with particular attention to the canal was, you're closing our only park, and you're going to lead us to have an increased obesity endemic. And so, we have to come up with some creative ways. So actually it was great, in collaboration, we did come up with some opportunities for physical activity at some of our health hubs after that phone call. And so it's, again, so nice to have these partnerships and really strengthen these relationships. The other challenge is that most of the staff of the Department of Public Health transitioned into DSW roles for testing and vaccination. My own champion provider partner actually has been leading the canal response for both testing and vaccination. So a lot of our interaction has been just related to COVID, so testing and vaccination. But we've still seen each other, so that's really nice to see her on community meetings. One thing that Marin County did do was hire a parks ambassador, and that has been amazing. She has, done such great work with developing walking podcasts that have been in Spanish, and setting up online calendars with activities to perform at the parks that we've been able to share out with the community. And so with particular attention to parks that have a walking path, we've been able to send that information, and it is published on the Marin Parks RX website. Next slide. So this is one of the activities that she's put together. It's called the Remedy Route. And so again, sending this information out, we're starting to use this with our patients. So again, reminding people that even in a time of COVID, they do need to get outside, and setting some goals for physical activity, either 10 minutes, 5 minutes, several days a week. I know in talking with my patients over the last year that one of the really important things, even as things shut down, was reminding people that they needed to get outside, and that being outside was safe. And we found that to be a very important tool in helping people stay healthy and really with their mental health. Next slide. So some of our next steps that we have been thinking about over this last few months is engaging the schools to prescribe Parks prescriptions. We know, again, with our adolescent youth, that we're really trying to increase the physical activity. I do have a plan to revisit the bus routes and reestablish that park route. And again, I think one of the really nice things about partnering up with our Department of Public Health, both with testing and vaccination, is really strengthening those relationships. So even though everybody was repurposed as a disaster support worker, I have to say I've had more interaction with all of the parks folks. So all of the rangers have been at my clinic doing testing and vaccination, and it's really nice to build those relationships. It gives us great ideas for when we can get families back out into the parks. And then we're planning on creating a scavenger hunt to re-engage families. We think this is a way that we can get people back to the parks safely and socially distanced. And so that's sort of our next step, is bringing families to the park, both for these activities, and we may partner that with COVID vaccination as a way of reaching the community in other ways. And again, I want to thank all of my partners, again, my colleagues who, were in cohort 2, who have definitely been excited each time we're, going through an email chain and trying to get people back into the parks. I think we've all seen it with our families and really wanting to get families back out into nature and give them some additional hope. And this is a picture of me and Kathy at a testing event who showed up at my clinic. And so I said, oh, let's snap a quick picture. And then just a picture of the sun, that not all coronas, take away our hope. So this corona was particularly beautiful one night when I was taking a walk. And I guess, lastly, just in relation to, just in relation to the Champion Provider Fellowship, I also just wanted to acknowledge the fellowship as a whole. I did not do a lot of public presentations before this fellowship. I certainly did not do a lot of writing, and I have written 2 op-eds since I started this fellowship that have been published. I don't think that would have happened without the great work of the fellowship and training and participating in some of those activities related to, narrative stories and the importance of our voice in the community.
Thank you. Thanks so much, Melanie. So our third presenter is Dr. Shikalpi Pendekar. Since 2003, Dr. Pendekar has been a dentist at Gardner Health Services, a federally qualified health center in San Jose. She is part of the county's coalition against sugar-sweetened beverages, president-elect and member of the board of directors of the Santa Clara County Dental Society, and serves as chair of the Santa Clara County Collaborative for Oral Health. Dr. Pendekar also holds an MPH, specializing in international health epidemiology from Emory University, and previously worked at the CDC. She's a member of the Global Dental Ambassadors and presented internationally on the importance of public health dentistry. She's also a graduate of the American Dental Association's Institute for Diversity and Leadership. Dr. Pendekar strongly believes and advocates for a holistic, integrated, whole-person, trauma-informed model of providing care. And with that, I will turn it over to Dr. Pendekar for her presentation.
Thank you, Agata, and thank you, Alana, for putting this together. I know it was last minute touch and go because I just got back from India, and sorry to put you guys in that spot where you were scrambling to get my presentation, but I'm so happy to be here. It's always wonderful to be back with the CPF, or the Champion Provider Fellowship family, as I like to call it. So next slide, please. Bagata went over some of my background information, so just wanted to highlight that my focus and my work has always been rooted in advocacy, access, and prevention. That's what drives me. And with that goal in mind, I have started the Collaborative for Oral Health here in Santa Clara County, been part of organized dentistry for the longest time. I'm a delegate for California Dental Association as well as for the American Dental Association, where we do work on resolutions that affect what we do in our profession and how it helps our communities. Next slide, please. So my focus has always been to reduce the sugar-sweetened beverage consumption in Santa Clara and now in San Mateo County. Mostly because as a clinician, I've seen the effects of sugar and SSBs, on the dental health and oral health of the patients that I serve. Having worked at Gardner, which is an FQHC for over 18 years, we serve the most underserved of populations in our communities, and those are the ones that are most disparately affected by the use of sugar-sweetened beverages. And so I've always sort of tried to figure out what can I do? It's not just about drilling and filling the teeth, or it's not just about, removing a tooth that's abscessed, but there has to be more to it than that. And that has always sort of been at the back of my mind, trying to figure out what can we do to prevent. And so that has been the goal of my work in terms of the work that I've done with the SSB in the SSB field. Next slide, please. As most of us know, drinking just even couple of sodas a day is going to increase the risk of a variety of chronic diseases, including heart disease, obesity, type 2 diabetes, and of course, tooth decay. Next slide, please. And for the dentists in the group, we all know that there's a strong link between the amount and the frequency of the sugar, the sodas that our clients, our patients intake, and the tooth decay and the tooth loss that it causes. The other effect of SSBs is the dental erosion. Most of these beverages have very low pH and they're highly acidic, and that affects the enamel, which then causes dental decay. Oftentimes, folks who are used to drinking a lot of sodas or a lot of these beverages will also have the habit of swishing or holding the beverage in their mouth, which affects the teeth as well. And then the dual effect, because of erosion as well as the sugar content of the beverages, is detrimental to the teeth. It also has a negative effect on the gingiva and the periodontal, and causes periodontal disease, leading to tooth loss. So the larger, broader effect of tooth loss, as we know, is not just in the mouth, but overall health, as well as has economic and mental health consequences. You know, it's harder to find employment when you have multiple teeth missing, harder to find partners, you can't talk, you know, smiling. And those of us who are dentists see this in clinic regularly. When patients come and say, "Doc, you know, I really need to have teeth. I can't eat. I can't find a job. I feel horrible." And so, you know, it's for folks who think that it's just a soda, it's really more than that. Next slide, please. So just a little bit of background, and the data is a little bit older. I'm sure, you know, maybe the numbers have changed and you can look that up, but generally in the county, we can see that, you know, Latino and African-American high school students and middle school students are more likely to be overweight or obese. Next slide, please. And then this, you know, is reflected in what they're doing. So they're more likely than their peers to consume one or more sugary drinks daily. So you can see the difference in numbers, and it's huge. And as I said earlier, it's a question of how these underserved populations are disproportionately affected by SSBs. It is a matter of equity, it is a matter of health equity, and we got to do something about it. Next slide, please. So with all that in mind, this goes way back when, to February of 2016, a group of local community partners came together, and I was invited to present specifically on the effect of SSBs related to the oral health to this group. And at that meeting, we wanted to gauge the interest of, you know, the community in forming a coalition that would focus specifically on reducing SSB consumption in Santa Clara County. And so in April of that year, we formed what was called the SSB Coalition, for lack of a better word, which then we renamed in 2018 as the Healthy Kids Coalition. Next slide, please. So these are the existing members of the Healthy Kids Coalition. As you can see, we've got the American Heart Association, federally qualified health centers such as Gardner and Children's Dental Clinic, First Five of Santa Clara County, Healthier Kids Foundation. We've got representation from the Santa Clara County Board of Supervisors, which is always great to have elected officials be part of, you know, what you're trying to do. And then of course, the Santa Clara County Dental Society. We've got the Public Health Department, of course, and then the Silicon Valley Black Chamber of Commerce and Working Partnership USA. Next slide, please. We do want to have more representation from Latino and Asian communities, and then of course from the hospitals that are in the county, such as Stanford and El Camino Hospital, school boards and school districts as well. These are members already of the Collaborative for Oral Health. So there's quite a bit of overlap in both these organizations, the Collaborative for Oral Health as well as the Coalition, so we can try to work together on some of these common elements. Next slide, please. So the early accomplishments of the Coalition, in June of 2016, right after we formed the Coalition, we basically decided we wanted to have a three-prong approach. So we wanted to do outreach and education. We wanted to work on warning labels on advertisements, and we wanted to look into and explore possible taxation. Couple of those we were not able to move as we wanted to, because at the time there was legislation going on in San Francisco because of their warning label that they had just introduced. And then with the taxation, as some of you might recall, a few years back with Governor Brown, there was this deal that was sort of made with the beverage industry. And so it took away the power of local government to actually, levy taxes on SSBs. So work is going on that, and we're trying to figure out how to navigate that. And the California Dental Association, as well as the California Medical Association, has been working together on that. So in later that year, the Board of Supervisors in Santa Clara directed the Public Health Department to investigate interventions to address overconsumption of sugar-sweetened beverages in the county. Next slide, please. And then as you can see, in April of the next year, 2017, we had a panel presentation. I was part of the panel. I presented obviously on the oral effects of SSBs, but we had a great panel. We had Dr. Sarah Cody, who we all know by now, and Dr. Jim Krieger from Healthy Food America. We had Dr. Antonia Charles, who is another alumni of this excellent program, of this excellent fellowship program. And so we presented to the board, and what came out of that was that the board adopted an ordinance requiring the children's meal default beverage to be either water or unsweetened milk, which was great, because then from then on, if parents wanted their child to have a soda, they would have to pay for it separately, which was a deterrent to switching the default beverage. Later that year, the Santa Clara County Health and Hospital System also adopted a policy which ended the sale of sugary drinks at county hospital and health campuses. So these were two huge victories, which were due to the work of the coalition, as well as what we did together as a group. Next slide, please. Just to show you the flyer that was then distributed at the time, just explaining the ordinance to the restaurants, what was permitted along with the children's meal and what wasn't. Next slide, please. So we continue to build momentum. We continue to work on outreach and education campaigns. The Public Health Department continues to provide scientific and clinical expertise on the effects of SSBs, as well as information on soda taxes, where they have been already been in place. There's monitoring of the adherence to the kids' default meal beverage ordinance. And then in San Mateo County, where I now direct the oral health program, I've tried to collaborate between the NEOP program as well as the oral health program, and to put out events such as staple clinics and the Healthy Snack Day, as well as the Rethink Your Drink Day, just to continue the push for drinking water and reducing the use of SSBs in the community. The other thing I've continued to do is working with the California Department of Public Health, as well as the State Office of Oral Health, as Alana had shared with you guys about around February. They sent out some information that can be shared as clinicians with your patients. It's a simple flip chart that you can share about talking about the SSBs, and there's a video to go with it. And I'll share the links in the chat box again for those of you who are interested. Next slide, please. So we are all champions. That's why we are here. And this program gives us the tools and teaches us how we can do more. So there's different roles that we can all play. We can be a leader, we can be an advocate, or we can be an amplifier, or we can be an expert, subject matter expert. We can work with a coalition that then helps to motivate and support the local health department's efforts on whatever activity you're choosing to do. In my case, it was all about SSB reduction, but there's prescriptions, as we've heard before, there's food security, and all of those, you can work with a group and you can play your own part. The goal is to advocate for policy systems and environmental change. And you can be that non-governmental voice. You can speak up, you can, feel free to say what you have to about what's going on in your community and how you would like that change. Next slide, please. So I just wanted to acknowledge a few people here. Barney Broderick, Dr. Broderick from Santa Clara County Public Health Department, Laura Jones, Teddy, all with chronic diseases and prevention unit there. And then of course, the champion provider team. You guys are amazing, Alana, Vagata, Jessica, Dean. The Dental Society has been a huge asset. Candace Roney, who's our ED, has a lot of experience working in the Valley. She's worked at Stanford, so she gets it. And then of course, the Healthy Kids Coalition and partners. It's a team effort. We can never do anything on our own, but I'm glad that I'm part of it, and I'm glad that I'm able to do something to change what I see in clinic. So thank you.
Thank you. Thanks, Dr. Pendekar. So I'd like to move on to our final work in progress presentation, Dr. Barry Chang. Dr. Barry Chang is a general practice dentist who, after initially starting in private practice, now serves as a dental director for CommuniCare Health Center, the federally qualified health center in Yolo County. He has served in this role for the last 10 years. At CommuniCare, he is part of an outreach team, Smile Savers, that at a variety of community sites provides education on topics including oral health, diet recommendations, and fluoride application. In addition to his clinical work, Dr. Chang is also a member of the California Primary Care Association Dental Director Network Group, chair of the Redwood Community Health Coalition Dental Director Network Group, and a member of the Yolo County Oral Health Coalition, which has allowed him to work closely with the county staff and leadership. And with that, I will turn it over to you, Dr. Chang.
Good morning, everyone. Are you able to hear me okay?
Yes, you're coming through great.
Thank you for the invitation. My presentation is pretty short, but hopefully it will highlight on the activity we did for this project, and hopefully we are good with time. Next slide, please. A little bit about me. I'm the dental director at a FQHC CommuniCare Health Center in Yolo County. And the major population we serve are the low income and underserved population in Yolo County. Next slide, please. The patient we serve, around 65% are 100% or below poverty national guideline. So for some of our patients, access for healthy food, it's not ideal. Also, the knowledge of healthy living might not be adequate. Transportation at times could be difficult. Transportation for grocery shopping, also to come into clinic. There are quite a bit of our patient population that will have to take the bus to get to us. So it's the same thing if they have to go for grocery shopping. So definitely more outreach activities will benefit the community. And next slide, please. So the next couple of slides, I'm going to highlight on the activity that we did. So this is a picture of the Food is Medicine Garden at one of our sites. And this is a place to connect healthy food and clinical care for our patient and staff. So we have 13 fruit trees, we have 12 raised bed, we offer outdoor classes, we offer outdoor cooking classes under a tent, and we're producing about 1,500 pounds of fruits and vegetable for our patient. So daily we put a cooler in our waiting room, and we text patient that their produce and fruits that's available to them is self-serve. So this is wonderful. As you could see from the picture, we got some funding in a grant. We also did a pretty big fundraising to get additional fund for this project. Next slide, please. Some additional activity we did. Alana, are you able to link that movie theater ad?
I'll put it out and I'll send the link to the fellows so that they can access it. I can't open it up.
Okay. Okay. So there are a couple of activities for the media. One is we put a movie theater at June of 2020. We placed a print ad in one of the community literature magazine, also May 2020. And we designated May 2020 as Rethink Your Drink Month. And we also launched an ADA curriculum at the Unified Davis School District. So we presented to 12 elementary school. We did outreach. We do oral health presentation, and definitely addressing various elements of oral health, including healthy food and beverage. Next slide, please. Those are some of the material we pass out to the student when we do outreach activity in the schools. And it's also to the community. The print is kind of small. I don't know if you guys could make it out. Next slide, please. We also put a bus ad on all the Yolo County 72, I believe, buses in the month of February 2020. And those are the ad on the bus. Okay, next slide, please. So definitely the partnership with the Yolo County Department of Public Health, it's a major contributor to all these activities. So we have a monthly meeting for the Yolo County Oral Health Advisory Committee, and a lot of activity that will stem from those meetings. The challenge is to try to find time for meeting for all the various people involved. So that was difficult. The success, there's just great support and resource from both the staffing issues and reaching out, connecting to so many different partners with the different activities, the movie theater ad, we're able to connecting to a media firm for those presentations. So definitely a very close and productive partnership with the Yolo County staff. Next slide, please. So during COVID, it was very difficult for sustain the PSE activities. At my department, we have to shut down basically 95% of visit and only seeing emergency care for almost 3 months. Even at this point, we're probably 85% capacity. And staffing has been a major difficulty. We just don't have enough support staff to support full capacity. It's also COVID definitely shift the focus. You know, we constantly have to worry about our PPE inventories. We're looking at air exchange, air circulation in the clinical space. We have extraoral suction unit addressing aerosol producing procedures. So it's very different. It's a huge financial burden for the clinic to make sure those equipment are in our space to protect our patient and our staff. Next slide, please. From my personal perspective is, how are we gonna sustain momentum? I'm hoping, counting on the resource of UCSF and with the fellowship, with the past and current cohort, we could sustain this momentum. And for Yolo County, it's definitely try to stay connected with the county staff for more outreach activities. One of the questions for the cohort is, how do we measure success? And how do we measure challenges? Those are the questions I pose to the group. Next slide, please. Thank you all. I definitely want to express my appreciation for all the UCSF team, to the past and the current cohort, also for the staff from the Yolo County Public Health Department. Thank you all.
Thank you. Thanks so much, Barry. So we have a little bit of time for questions and discussion. I think we'll give us, let's say, about 7 or so minutes. Does anyone have a question that they'd like to bring up? If there's not a pressing question while folks are thinking or putting them in the chat, I think maybe we can start with Dr. Chang's last question about how do we measure successes and challenges. I think everyone can agree that that's probably been quite challenging during this past year, especially with COVID. So if any of the presenters want to speak to how they reframed that or thought about that in terms of the work that they were doing. Great. I was going to pick on Dr. Bajwa. Are you unmuting there? I thought you might have.
Yeah. So this is something that I was considered at the when we made our shift to food insecurity. Is what were we looking at specifically to know that our intervention had made a difference, not just for our patients, but for long-term health outcomes and the work that we were doing within our clinic flow and efficiency. And that's where, starting with the discussions with the patients and our stakeholders was so imperative to say, okay, well, if we're defining success by our own terms without actually talking to people who are receiving these referrals and processes, we're missing the mark here. And that was a little bit hard for me in my academic brain to remove itself from Likert scales and knowledge change and those sort of things to say, well, what are the endpoints that we're looking at that are important to our patients? And really it was just the feeling of food security and having an understanding that this is something that was available to them. And even the knowledge that the clinic was, in a sense, advocating on behalf of them for this purpose was and is valuable. And while we're still going to do the throughput numbers on things like chronic disease management and outcomes, which are a little bit more challenging and nebulous to hammer down, that's one of the goals of our meeting with the managed care team is how can we take the work that they're already doing in tracking chronic disease management and apply our project within that scope and hopefully convince them that it's worthwhile to fund our project in the meantime. But that was something that I did struggle with, and I appreciate, you know, Dr. Chang bringing up that point, because at the onset of the project, I was looking at it from a very discrete perspective, and once I moved away from that and had those community conversations, it shifted my perspective in a different way. With that being said, if other folks have, you know, had successes with their operational kind of coordination of outcomes and measures, I would love to hear their perspectives on that.
I was just going to piggyback on that and say the same thing. I mean, you know, we could certainly measure obesity and see if we see a decreasing trend, but I think ultimately we're thinking about like the overall health of our community. And I have another project I'm working on with ACEs, and we're doing a lot of focus on the resiliency piece. And the one thing that makes me think about like Park's prescription and changing our mindset about how we do measure outcomes is we're giving this ACEs screener, and then we've done some follow-up phone calls to ask people what they think the screener means. Like, why do you think we asked you about it? And I think the most fascinating thing is all of our patients now have said, oh, because of COVID, because of my experience with COVID. So they have never associated any of their other trauma that we're actually thinking about for their health outcomes, but they certainly attribute the fact that we are asking these trauma-informed questions related to COVID. So it does, you know, it makes me think a lot about the resiliency pieces. We're doing a resiliency screener too. And so, if there, you know, I think maybe as a collective group, if we can think about that with all of the different work that we're doing. And, you know, it could be something we collaborate on broadly, because I do think it's a really important piece for all of the communities that we're serving.
I think I would echo what both Melanie and Moazem said about this. Sometimes it's also about, you know, raising awareness, like how much traction are you getting on the issue that you're working on, right? Talking to electeds about it. Every opportunity you get, just putting it out there. I think that itself is important. You know, for example, and we're talking pre-COVID time, of course, when there are events and you go to an event, and I've done this, I've seen, you know, sodas being served, and this is an local elected official. And if there's sodas being served, I've sort of gone and talked to their staff person who I know pretty well. And I've said, this is interesting. You know, you're so focused on like improving the health of your community, and you back all these legislations that are health focused, and yet, yeah, you know, you're serving sodas at your event. I mean, that doesn't send the same message. So just even raising awareness, I think, just being out there and speaking your mind and getting people to realize that this is an issue, I think that's important too. And to me, that would be a success as well.
Wonderful. I think all really important points, and thank you all for great presentations. I think we were able to see a spectrum of work over the course of the fellowship, and it's just wonderful to see how much all of you have been able to accomplish and how much you've been able to share from your experiences. So thank you so much for your time. Welcome back, everyone. I'd like to introduce our partners from the California Department of Public Health, Nutrition, Education, and Obesity Prevention Program and Office of Oral Health. We are incredibly grateful for their continued support of the Champion Provider Fellowship. First, we will hear from Dr. Lauren Whetstone. Dr. Whetstone has evaluated SNAP-Ed in California for over 7 years. She is Chief of the Research, Evaluation, and Strategic Alignment Section and Acting Branch Chief of the Nutrition, Education, and Obesity Prevention Branch at CDPH. He's leading efforts to evaluate healthy eating, active living, obesity prevention interventions with a focus on policy, system, and environmental change strategies. Dr. Whetstone is an author and editor of the SNAP-Ed Evaluation Framework and the accompanying interpretive guide. She has a PhD in applied cognitive psychology from the Claremont Graduate University, and she held a faculty position at East Carolina University in Greenville, North Carolina, and has 18 years experience evaluating community and clinic-based obesity and chronic disease prevention interventions in underserved rural communities. Dr. Whetstone will be followed by Dr. Janet Kumar. Dr. Kumar is State Dental Director in the California Department of Public Health. He is a board certified specialist in dental public health and a former director and president of the American Board of Dental Public Health. Before joining the CDPH, he was State Dental Director in New York, where he held multiple positions. He has served as a consultant to many national and international organizations, including CDC, National Institute of Dental and Craniofacial Research, NIH, HRSA, the American Dental Association, Health Canada, and the National Academy's National Research Council. He led efforts in California to develop the California Oral Health Plan, and he's currently engaged in implementing the 2016 Tobacco Tax Oral Health Initiative and assisting the California Department of Healthcare Services in implementing the Medical 2020 Dental Transformation Initiative. So with that, I will turn it over first to Dr. Whetstone.
Good morning. Thanks so much for the introduction. So good morning to everybody. Welcome to the mini college today. I'm just going to give some brief remarks about CDPH and our branch, the Nutrition, Education, and Obesity Prevention Branch. So as you know, public health professionals, like all of you, are working to improve the health of families and communities by promoting healthy lifestyles, preventing disease, and removing environmental dangers. So CDPH works in collaboration with your public health offices, your local public health offices, and oversees a variety of research, response, and prevention programs to protect the public's health. So right now, no surprise, CDPH is prioritizing COVID-19 response and vaccinations. The response is consuming seriously a substantial portion of the department's capacity and resources, but we are still really committed to our regular programming and work, and this work has continued, albeit modified, but continued throughout the pandemic. At CDPH, you all know we're focused on addressing disparities in health, and with the wide diversity of programs and services, our sort of daily pursuit of health equity looks different depending upon where you are in the department. But I want to just talk about our branch, specifically the Nutrition, Education, and Obesity Prevention Branch, and tell you that we are particularly focused on healthy eating, active living, and state and local systems and environments that make those things possible. So we have a focus on vulnerable communities, primarily communities with low incomes, those that experience the greatest disparities in health outcomes, and those that suffer inequities in access to goods and services. And those factors obviously go hand in hand. So our branch is primarily funded by the federal government. We receive funding from the U.S. Department of Agriculture through the SNAP-Ed program and some funding from the Centers for Disease Control and Prevention. The Champion Provider Fellowship, which all of you are here today, I was a part of, is funded by the USDA SNAP-Ed program. Here in California, SNAP-Ed is called CalFresh Healthy Living, and it's part of the broader CalFresh suite of programs that you probably have heard about. So those programs that provide funding for supplemental food assistance, SNAP, disaster relief, and job training. So through CalFresh Healthy Living, we fund local health departments in addition to supporting some state level projects like Champion Providers and a statewide social marketing campaign. So these combined efforts allow us to reach individuals directly, but to also impact communities through changes to their neighborhood community settings and to support broader community changes. And we hope that through our work and the work that you all will do, that will influence cultural norm changes around healthy eating and active living. So we are especially interested in influencing and supporting upstream efforts to create healthy communities, right? So we want to include efforts that involve healthy eating and active living, but they might not be exclusively about them, right? So some other more upstream kinds of progress that we might want to make. So we really want to work at all levels of the socio-ecological model at the same time, right? So we're really sort of wrapping around Californians to really help us in our pursuit of greater health and well-being. So we know that the pandemic and likely the post-pandemic environment provides a unique opportunity to address chronic conditions supported by a healthy diet and physical activity, right? We know that there are protective factors related to health outcomes related to COVID-19, those conditions that are more likely to lead to severe health outcomes. So discussions around obesity prevention and health equity are really timely right now and help to support a healthy California. So just in my last couple of minutes, I want to mention a few of our programmatic priorities. One of our main priorities, and this is nicely connected to Dr. Kumar's work, is in reducing sugary drink consumption. It's the largest source of added sugars in our diets and has a strong connection to both overall health and specifically oral health. Many of our local strategies at the local level are focused on nutrition and healthy food and beverage access. But as I mentioned, we're also really interested in looking more broadly at areas that look at like beverage policies and those policies like excise taxes and those that impact placement and access. As a sort of companion to that, we're also very focused on water access and appeal. So we're looking at that as an alternative to sugary drinks, right? So drink water, not sugary drinks, but also looking at the health benefits of hydration as it pertains to diet and physical activity. And then the last priority I want to mention is our emphasis on youth. So we know that healthy and unfortunately unhealthy behaviors and weight are likely to follow children into adulthood. So we're very interested in reaching young Californians to create healthy habits for life. So I know I just have a couple minutes all together, so I just wanted to give you a few of our priority areas and a few of the areas in which we're focusing our work right now. We're always happy to talk more about them in another situation, but I'm happy to I wanted to let you know a little bit about those priorities. So as champion providers, the Champion Provider Fellowship gives a really trusted and credible voice to some of these same messages that I just mentioned. And as this program provides you with guidance on like messaging and tools for communicating, we hope that it provides you with some support to champion your chosen cause, but then by extension, it's likely to help us in championing healthy eating, active living, and health equity in many ways. So I want to be able to turn it over to Dr. Kumar, but thank you so much for joining us today, and I really look forward to following your successes with the program.
Thank you, Dr. Whetstone. Good morning, everyone. Our Office of Oral Health is fairly new. It's about 3 years old now, and our mission is to prevent and control oral diseases through community-based efforts. We didn't have an organized program before, so in 2017 we received funding through the tobacco tax, and now we have funding to support local health jurisdictions. So in one of our main functions is assessment, and now with a statewide program, we are able to support some of the community-based interventions. So in 2019, the Lancet, the journal, published 2 papers and to bring attention to global problem of oral diseases. It affects about 3.5 billion people worldwide. Disparities are profound. And in that report, they made several recommendations, 2 important ones for us. One related to policies and regulations regarding sugars. Sugar drinks, and the second one is related to promoting fluoride through water and toothpaste. So we conducted a survey here in California last year. We surveyed about 12,000 third grade children across California and looked at trends over time. And California, in the last survey that was conducted in 2005, California was ranked next to Arkansas in terms of prevalence. Very high prevalence of the disease. So this time around, when we repeated the survey, we see a decline of about 10 percentage points from the last survey. So that's the good news. But we still see profound disparities with respect to race and ethnicity, income, Regionally, we see big disparities with Bay Area counties doing very well compared to some of the Central Valley counties. So our focus right now is reducing this tooth decay in children, especially in young children. So I had this vision, 3 by 3, that is all 3-year-olds should be cavity free. And 3 years later, when they're ready to enter kindergarten children, we have this requirement, all kindergartens should have their teeth checked because we want to deliver healthy children to schools. So all those children should be cavity free. And 3 years later, when we do this California Smile Survey, we should see a big difference in terms of caries prevalence. So so we have developed 5 components in our program to address this. The first one is community water fluoridation, which is recommended by the community guide. The second one is school dental program. That's also another intervention recommended by the Task Force on Community Preventive Services. And the kindergarten oral health assessment, it's a requirement. And we want to gather the data, track progress, because one of our biggest challenges is we don't have data at the local level. We hope that through this, we can gather data at the local level. And then dental visits, which is one of the leading healthy indicators. And lastly, oral health literacy, which is a foundational principle right now in Healthy People 2030. So when we talk about oral health literacy, there are 2 dimensions to it. One is the increasing the capacity of individuals. The other one is increasing the capacity of providers to communicate very clearly using simple languages. So we are focusing on developing a toolkit, working closely with University of Berkeley. So this is this disease in children can be addressed. It's through some very simple measures, encouraging people to drink tap water instead of sugar-sweetened beverages, preferably fluoridated water. And the second one is tooth brushing daily. And third is regular dental visits, starting these dental visits as early as possible in a primary care office. So these interventions are very simple, but very difficult to achieve. So hopefully we will be able to make significant progress over the next few years. So we are looking forward to you, because we need champions in the communities to promote some of these interventions and policies. One policy I'm really interested in is requiring all early education care programs to implement toothbrushing just the way it is a requirement in Head Start. So if we start doing that, we will see, I'm convinced that we'll be able to see big improvement. So thank you for inviting me.
Thank you for being here. Thank you both. Thank you, Drs. Kumar and Whetstone. We appreciate your continued support of the fellowship and partnering with us and all of the support that brings.
Thank you very much for having us today.
So with that, I'll go ahead and move on to our next presenter, Dr. Gail Gazelle. And if anyone has questions for Dr. Whetstone and Dr. Kumar, please feel free to put them in the chat, and we'll look into getting some answers for those for you guys. Dr. Gazelle is a former hospice physician, part-time Harvard Medical School assistant professor, and master certified coach for physicians. By phone and in person, she has coached over 500 physicians and healthcare leaders on leadership development, communication, teamwork, conflict management, mindfulness to build resilience, and emotional intelligence. A longtime mindfulness practitioner and educator, Dr. Gazelle is also a certified mindfulness meditation teacher. Dr. Gazelle is the author of the 2020 Everyday Resilience, a practical guide to build inner strength and weather life's challenges. Her work has been featured in diverse venues, including the New England Journal of Medicine, the Physician Leadership Journal, and the Oprah magazine. You can find out more at her website, and we can link that in the chat, as well as a worksheet that we will be working through in the session. Thank you so much for being here, Dr. Gazelle.
Thank you. I'm really delighted to be here, and thank you everyone for making this time. This is going to be a very practical session. This is about building resilience. This is about overcoming the imposter syndrome and really coming away from this session with some practical tools. So I want to just start really with the overview that I think all of you are aware of, that there is tremendous distress in healthcare, isn't there? High levels of burnout, under-resourcing, so many below-grade tasks that fall to the doorstep of physicians and other highly trained clinicians. And frankly, the high levels of burnout that we saw, the 40 to 60% throughout healthcare, really predated 2020, predated the pandemic. And they also predated, as we saw, predated everything that we've seen and everything that all of you on the front lines in various specialties in California have borne witness to over the last year. And all of the uncertainty, all of the challenges, all of the fears, all of the worries that each of you knows all too well, that bears down and has really just added to what was already there in terms of high levels of distress. Similarly, all the political turmoil, which obviously didn't end with the elections in the United States, the political turmoil around masks, around vaccine hesitancy, something that I think it's fair to say almost all of us are confronting on a daily basis. So there's a lot here. I can't change all of those things. I'm not here to try that. I don't have that particular magic wand. But what I am here to do is to help provide practical strategies. And I want to start with a poll question. Did your professional training help you learn how to manage all the stress of this time? And Alana, if you can launch that poll, wonderful. Did your professional training help you learn how to manage all the stress of this time? And if you're not sure, just give your best guess to this answer. Do you feel that it did? Yes. Or do you feel that it didn't? Whatever your specialty is. So I don't know if answers are coming in.
Yeah, we have about 60% response so far.
Wonderful. Can you put that up there?
Yes, I can go ahead and I'll end the poll, it looks like.
Okay, so look at this. We have, of the respondents, we have 8% said yes, professional training did help you learn how to manage all the stress of this time, and 92% no. And I think that's a fairly common response. I've given a lot of talks at this point in the pandemic, and that's what we frequently see, that our training teaches us about all kinds of diseases, many of which are such zebras that we never see them in a lifetime in our professional lives. We learn about all kinds of pathophysiologic pathways and all the advanced pharmacology, which is changing so rapidly, but we just don't learn these kind of resilience strategies that can really make the difference between burnout or the ability to run the marathon of a career in healthcare and actually thrive. And that's what I want to focus on today. My hope by the end of this session is that you'll understand more about why building mindfulness and resilience is really critical to your well-being. I'm going to spend quite a bit of time on the broad topic of resilience and what helps to build it. We're also going to focus on the imposter syndrome. The imposter syndrome affects a surprisingly large number of professionals in healthcare. I'm sure none of you are affected by it, but many people in healthcare are. And I want to really drill down on some of the mental hangups, frankly, that can precipitate are feeling like an imposter, and then give you some tools to work with and hopefully even overcome your suffering with imposter syndrome. Most importantly, you're going to get some practice. This is an experiential session. And as Dr. Semere mentioned, there is a handout that I hope you've been able to print out. If you want to take a moment to do that right now or to bring it up in the corner of your screen, I think you'll find it very helpful during our discussion. We're going to have more poll questions. We're going to have a breakout room where there'll be a chance for some smaller dialogue. And again, this is an active session. So I really want to encourage you to put your devices away if you can, and really give yourself permission to take this time for you, to fill your tank, to help build your resilience so you can really be at your best, both professionally and personally. Now, we have a free giveaway. Alana and I did some planning around this. I'm leading a workshop, actually a week from Saturday, called the Imposter No More Workshop. It's from 10 a.m. to 12 p.m. Eastern. I apologize that that's quite early in the morning for all of you in California, but we're going to be giving away 2 free spots in this workshop. So if you're interested, if you're free at 7 a.m. Pacific time on the 17th, please put your name and your email in the chat box. And then I believe Alana or Dr. Semere will be picking 2 winners at the end of my presentation. This is a 2-hour, very experiential session. And my hope in that session is that I'm going to be giving people the tools really to vanquish the imposter syndrome. So please put your name and your email in the chat. And just as we go along in our time together as well, I really want to encourage you to use the chat. This again is for you and your experience, and I think there'll be a lot of learning from one another as we go by. Now, I want to zoom out and talk about resilience. I did write a book in 2020, Everyday Resilience, a practical guide to build inner strength and weather life's challenges. And you're all familiar with resilience. And when you hear that word, you may think of a couple of definitions. One common one is the rubber band, right? Bending, being very elastic, and then snapping back to its original form. You may also think of the willow tree that bends in the wind, but does not break. The definition that I talk about in the book and that I'd like to share with you, kind of for the platform, the foundation of what we're talking about today, is that resilience is actually a well of resources that resides in each and every one of you. And it's a well that includes your strengths, your capacities, your courage, your fortitude, your wisdom, and your goodness. Now, that well is important because it allows each of you to weather whatever difficulties you face and reach your goals, because all of you have very important goals professionally and personally. And the well of resilience allows you to reach your goals with minimal, unnecessary wear and tear. In other words, is there necessary wear and tear in reaching our goals? Yes, there is, isn't there? To reach our professional goals, let's say, to get through training, which is often very difficult and demanding, to meet all the competing priorities in COVID and beyond COVID. There's going to be some stress there. There's going to be difficulty. We can't change that. But when we tap into our inner well of resilience, we have what we need to get through these difficulties, really minimizing the unnecessary emotional, physical, spiritual, psychological, any real form of distress. And you may be thinking, well, no, she doesn't know. I'm not as resilient as others. Resilience is really the stuff of elite athletes, right? Of superheroes and super women. And how is it that Dr. Gesell knows that I have this well of resilience within me? Well, each of you has traveled on a unique life trajectory, and each of you has gotten through difficulties, right? If you do a quick review of your life, you're probably thinking to yourself, well, gosh, I've gotten through many difficulties, illnesses, accidents, difficulties in careers, financial instability, job transitions, right? Challenges with kids, challenges with aging relatives. In other words, difficulty is part of the life journey for all of us. It is, small and large. Some of you may have had more difficulty in one domain and less in another, but it is part of the human experience. And the fact of the matter is that you are still standing. You're still here. Somehow you drew from inner resources and connected them to the outer resources that you needed to get through these life challenges. So that's really what we're doing today, is getting in touch with that well and replenishing that well so that you have what you need for whatever challenges you're currently facing. And in my book, I touch on 6 resilience pillars: connection, perseverance, flexibility, self-regulation, positivity, and self-care. And while we could spend many hours looking at all of these in a great deal of detail, what I hope to do is kind of take you through them one by one. And as I said, we'll pause and do some exercises along the way. And really what's extremely important about resilience is the fact that the human brain is highly malleable. Up till about 15 to 20 years ago, we learned that the human brain kind of stopped growing and developing after adolescence. I'm sure many of you, that was part of your healthcare professional training. And it was a rather pessimistic view, wasn't it? That somehow the human brain is learning and growing, but then all of a sudden it stops after adolescence. And the good news is that in the growing area of neuroscience, and in particular the subfield of neuroplasticity, we're learning that the truth is actually quite the opposite. In fact, the human brain is constantly remapping, constantly learning, constantly changing synaptic patterns based on what we learn and what we focus on a day-to-day basis. And this actually forms the basis for much of what I'll be talking about today and the specific exercises I'll be leading you in through. And it's important to understand how our brain has evolved. All of you are familiar, I'm sure, with the fight, flight, freeze, the limbic response. In days of old, in times of the woolly mammoth and the saber-toothed tiger, that's how we survived, right? We needed some system in our brain that could constantly survey the environment for threats, because we didn't exactly survive or move up the evolutionary chain because of our physical prowess, right? We moved up the evolutionary chain because of some of these developments in our brain. In times of old, this served us extremely well, but it's left us with a really profound negativity bias. You can see in this cartoon, the pictorial of the heart is looking at all these good things. Brain, come take a look. And the brain is sitting there with a magnifying glass, looking at the one bad thing and saying, not now, can't you see I'm busy? And when you reflect on your own life and you think about what you pay attention to in the course of the day, perhaps you're like the hundreds of physicians and healthcare leaders that I've coached who focus at the end of the day on the one thing that went wrong. There could have been 20 things that went well, wonderful patient interactions, really being able to treat somebody with a chronic disease, for example, good interactions with colleagues and with others. And yet, what many of us can fixate on is that one nub, that one thing that didn't go quite right. And that is the power of the negativity bias. So it's important to understand that because it pulls us into patterns that can actually keep us stuck in burnout. And so the stress response in modern times is not the woolly mammoth and the saber-toothed tiger. It's actually texts that we get. Words, images on a digital screen that we ascribe a lot of meaning to. And we can get a text, let's say, from a teenager, and all of a sudden we go from 0 to 90, right? Or from a colleague, we get a text about a case or something, and all of a sudden we're spiraling. We're getting really worried, fearful. What happened to that patient? Did I miss a diagnosis? Are they accusing me of doing something wrong? And this overactivation of the stress response can really leave us, like in this cartoon, tired, worn down, not at our best in facing the challenges that are upon us. And before we move to the more positive side of this talk, I just think it's important to recognize the impact that this chronic stress can have on us. This is a short list. Impacts, negative impacts on the immune system, premature aging of cells, as well as the entire human body, heightened inflammatory state, and all of you understand the role of chronic inflammation in many untoward diseases. Premature cardiovascular disease, unfortunately, early cognitive decline, and many, many other things. So it's so important to learn these resilience skills that we unfortunately don't learn in our training. And just briefly to touch on burnout. When we're in burnout, there's really three things that we experience that you see here. Exhaustion. Our well is dry. We're dragging ourselves, right, from one thing to the next. And even if we're lucky enough to get a good night's sleep, there's a real sense of emotional exhaustion. We also feel cynical. We wonder, why did I go into the profession that I'm in the first place? I'm not sure that I'm helping anybody. And with that cynicism, we begin to depersonalize. We see patients and coworkers almost as objects that we have to navigate through the course of our day rather than the full human beings that of course they are. And then we see a disconnection from our sense of meaning and purpose and from our own sense of our strengths and our accomplishments. And obviously burnout is the flip side of engagement. And then, you got to laugh too with RVUs and all kinds of compliance metrics. Here lies Dr. Jones, lifetime RVU below the median. So we have to add some humor to an otherwise challenging subject. So obviously, I don't think I need to tell you about the importance of connection in building resilience. We human beings are not an isolated species, right? We're a social species. And we now understand that loneliness is as big a risk factor for cardiovascular disease as smoking and a sedentary lifestyle. So the importance of connection really can't be underestimated. And for some people, that's a silver lining of the pandemic, that they have more time with family members, people who have a kid home, let's say from college. But it's also a complicated time, of course, for many people, all the demands of having people home. But how can we lean into the goodness in our relationships to help us fill our inner well of resilience? I want to move on, though, to perseverance. How do we persevere in the face of difficulties? And to do that, we really need to understand our strengths. So I'd like you to pull out that worksheet. And if you don't have it, perhaps just a writing implement and a piece of paper. This is my dog, Miss Sydney, for any of you who are canine lovers like me. She is very connected to her sense of strength and accomplishment. If you could see her, you would see as she caught that stick, the tail just waving wildly. She doesn't suffer from burnout like we human beings can in healthcare. So let's just go through these three questions. And I want to invite you to, someone says, I love Miss Sydney. Wonderful. Some other dog lovers in the audience. Thank you. Let's go to the first question. Do you tend to notice more your strengths or your weaknesses? Are you like Miss Sydney, really able to see, yeah, I did that well. I made that diagnosis. I really led a great meeting. I contributed to the work of my team. Or do you tend to focus more on the converse of that? So take a moment to answer that, to circle that on your worksheet. And again, if you'd be kind enough to put that in the chat. The second question is, do you focus on what you've accomplished or what you haven't? In other words, do you get to the end of your day and think to yourself, wow, look at what I accomplished. Look at the good that I did today. Sure, there were things that I couldn't achieve, much that can't be changed in healthcare, but look at what I did accomplish. Or the negativity bias, are you like many people that you get to the end of the day and you're thinking, oh gosh, look at what I wasn't able to do? And then the third question, do you pay more attention to what's going well or what isn't? So if you have any comments to put in the chat, please do. Many of us are on the negative side here. And again, it's the negativity bias in action. Our brains are conditioned to look for the things that aren't going well. So I don't want you to kind of add insult to injury and think, well, what's wrong with me? Am I just such a negative person? This is really an opportunity to learn. So one person writes in the chat, focus more on my weaknesses, on what I have not accomplished and what is not going well. Oops, and I market myself as a positive person. Thank you for sharing that. I doubt that you're the only one with that response. So we are actually, here's another one. I find myself doubting the work that I do. Thank you so much for sharing that. Again, I can tell you, you're not the only person who tends to focus that. So we're going to do an exercise now, and you'll be in a breakout room for about 10 minutes. Let me walk you through what we're going to do. You're going to be in a breakout room with three total, you and 2 other of your colleagues. And I want you to think about a moment at your work when you felt you were at your best, a moment in time. It could be with a coworker, a trainee, a patient, attending or giving or leading a meeting, or a moment when you were giving a presentation. I want you to take a moment now to bring that moment in time to the fore. And you're going to tell the other members of your triad about this moment in time. Their job is to listen to you, to let you kind of have the floor for a good minute to 90 seconds. And then you're going to try to identify what strengths you evidenced in this situation. And on your worksheet, there's a list of possible strengths to use. You don't have to use these. There's certainly other strengths out there, but I wanted to give you some ideas. Then you're going to brainstorm, the 3 of you in the breakout room, how you can use one of these strengths to help you overcome some challenge that you're having in your workplace. You're going to have 3 minutes apiece. If we're successful with the technology, we'll have a broadcast message when it's time to change. I'd like you to start with the person with the shortest hair. Then you'll go to the person with the second shortest hair and the third from there, because we don't want to waste time kind of juggling who's going to go first. And those are the instructions. I'll be here. I won't be in one of the rooms. I'll be womaning, let's say, the chat. And if you have any questions or something doesn't seem to, if you need some clarification, please put that in the chat. So I hope those instructions are clear. Alana, if you can set up the breakout rooms.
Perfect. It looks like we'll go ahead and hold on 1 second.
And you won't have a ton of time. Again, 3 minutes per person, so a total of about 10 minutes. So you need to just keep things moving along, but hopefully you can get to each of the 3 of you. Everyone squared away, Alana?
Yeah, I'm just moving some people around that don't look like they've joined a room. So yeah.
Sure. Sometimes there's some people who choose not to join.
Yeah, that's what I'm noticing. So I'm just rearranging some of those people. We do have some that are just 2 people, but I figure that's better than doing 4.
Yes, thank you. That's great. Really appreciate it.
No problem.
And are you keeping an eye on the time for the broadcast?
Yeah, we're at 10:59 right now. So I'll probably just getting them into their rooms, but you just give them 2 minutes, 2 more minutes before I send out a message to switch. Is that okay?
No, perfect. But you've got that under control, in other words.
Yeah.
Thank you, boss.
No problem.
Oh, this is great. A bunch of people signed up for the for that lottery. Good.
Hi, who's currently in this room? Hello?
Thanks, Alana. Wonderful.
Okay, I'm gonna go start closing the room, so they'll be making their way in.
Thank you.
Mhm.
Since I can't see all of the faces, when you have an idea of most people being back, just kind of give me a sign.
Of course.
Thank you. So people are coming back.
And some are still chatting.
Got it. That was the whole point. So for those of you who are back, you can put in the chat any learning that you had about your own strengths, about ways that you might apply them. One person has already said that that was a fun exercise. Does it look like most people are back, Aletta?
Yes, the rooms have closed, so everybody's back in the main room.
Wonderful. So please, yes, take a moment to put in the chat any learning for you about your own strengths. And if anybody would like to unmute and not to talk about their own strengths, but to share anything about one of the people in your triad. Just briefly, what strengths they evidenced and any ideas that the 2 or 3 of you had about how they could utilize those strengths. We'll have time just for a couple of brave souls to toot the horn of one of your colleagues. No takers, huh?
I can share about Kristen, if that's okay with you, Kristen. We had a 2-person group.
Sure.
So I think Kristen, shared a really wonderful story about establishing a connection or rapport with a patient, a young woman who was struggling with, mental health issues and really kind of trying to go beyond some of the traditional things that we think about in terms of just the therapy and medications, and built this connection that led to realizing her passion for the outdoors and how limited that was as expected during COVID, and how much of an impact that was having on her well-being, and came up with a plan that really resonated with the patient in terms of how they could address her issues moving forward, that incorporated expanding, increasing her time outdoors, and has really kind of been able to have some successes with that patient moving forward. And we talked about how she'll leverage that ability to develop relationships and personal connections, and definitely being attuned to the importance of nature. And that's certainly a passion of Kristen's, and she's using that on a broader scale, working with park systems locally to kind of make sure that she's thinking about the well-being of young people during this time.
Wonderful. Congratulations, Kristen. That was wonderful to hear about that. I hear something in the chat. I learned that passion is a strength in all 3 of the people I had in my small group, and how this has driven they and us to complete projects even in the face of adversity. Wonderful. And then another person wrote, both my teammates were partners. They both have strengths of networking and delegation, and are looking forward to working on projects that were previously on the back burner, inspired after this mini college, and identifying their networking skills and partners. Wonderful. So for all of you, whether you put it in the chat or spoke to us or not, this tendency, the negativity bias that really takes us away from looking at our strengths and kind of keeps us fixated on what isn't going well. And this is a vital part of resilience. So the takeaway that I really want each of you to have is to think about your strengths. You now have that short list on your worksheet. And I want you to look at that list and really think about, gosh, if I'm feeling kind of resourceless about, or really challenged, or even overwhelmed by some difficulties in my work and personal life, How, if the only things in my toolkit are these strengths, how can I leverage them? It's a creative exercise. I'm challenging you here, but I really want you to think about that because there's an interesting paradox. Often we think, gosh, if I don't focus on my weaknesses, how will I ever improve, right? I kind of have to beat myself and whip myself in order to continue growing and learning. But I want you to think about this. The fact is that the more we focus on what we're not doing well or still needs to be done, the more draining and daunting our tasks can seem. That's the paradox. When we focus more on what we're doing well and what we are accomplishing and have accomplished, we actually have more confidence and energy to accomplish more. And if you think about this, if any of you have kids, I'm sure many of you do, if you spend your time harping on what they're not doing well, if your child is struggling with math or reading or whatever, and you sit there and you talk about how they're not good at it and they never were good at it and they're slow and they're not getting it done, we know they're never going to show any interest, right, in whatever that endeavor is. But if we can support them and be realistic and say, gosh, you've overcome some difficulties before. I've really seen that you have it in you to do this. Then the child is motivated to actually take on the challenges. And frankly, this is what I've seen in the hundreds of individuals that I've coached and really the thousands that I've given these talks to. So I want to switch the frame and move to the resilience pillar of flexibility, because we need to be flexible to achieve our goals. And we really need to be flexible when we work with our own mind. And the human mind is a very busy place. We produce somewhere between 20,000 to 50,000 thoughts in a given day. And I think for many of us in healthcare, it's actually closer to 75,000. Our mind is busy, thought upon thought upon thought, many incredibly useful. Get out of bed, brush your teeth, move out of the way of that Mack truck, make this diagnosis of Lyme disease, right? Of course, we're not trying to get rid of cognition. On the other hand, I think all of you can probably identify that sometimes your mind is so busy that you can't turn it off, that you get home after a busy day and you want to be with your loved ones. You want to just relax and kind of turn your mind off. And yet for many of us, our mind is going, going, going. For many who struggle with insomnia, what is it that's going on in the middle of the night? The mind is ruminating, thinking about what happened during the day, fearful about what's going to come next, planning, puzzling, right? Strategizing. And that's one of the treatments of insomnia is working with the busy mind so that the mind can kind of quiet down and you can return to the body that desperately needs a good night's sleep. Now, you may not believe me. You may think, well, that's an overestimation. My mind isn't that busy. So we're going to do a very quick exercise, 2 minutes. I'm going to time 120 seconds. Your job in this 120 seconds is to count how many thoughts you produce. Okay? So you're almost going to be like a cat at a mouse hole, ready to pounce. Oh, there's a thought. There's another thought. You can keep a tally of the number of thoughts, or you can just do that mentally. We're going to sit silently, and I think you all can understand 2 minutes is going to feel like forever, but I will be honest, and I will only time 120 seconds. So we are going to start now. That's 30 seconds. That's 60 seconds. That's 90 seconds. That's 120 seconds. So we're going to launch another poll. Did you have one thought, 2 to 5, 6 to 10, or too many to count? Please take a moment to let us know. And be sure to tell the truth now.
All right, on the poll, we have about 75% reporting.
That's great. Okay, nobody had one thought. 9% of you 2 to 5, 43% 6 to 10, and a whopping 48% too many to count. It's really something when we stop and pay attention to what's going on in the mind, and we see just how many thoughts that we have. And you can enter that onto the second page of your worksheet. And the follow-up question is, well, what were these thoughts? What were the themes? Just take a moment to notice that. Oftentimes, when we pause and really look at our own thoughts, we realize that a lot of our thoughts are I, me, mine. Our minds are highly self-referential. I like this. When is my whatever going to happen? My children, what's going on with them? Here's somebody who writes, my recurrent thought was, what's that a thought? That's a good one. It can get kind of convoluted when we watch our thoughts. Sometimes we also notice that we have a lot of judgments. And the mind is very good at making judgments, at labeling things as good or bad. When we pay attention in this way, we realize how often we're making judgments going through our day. Why did that person say that? Oh, that was stupid. I don't like that. That didn't sound right. Oh, I'm worried about this. What if that happens, right? And we're judging and labeling. We also notice that there are a lot of reruns. There are a lot of repeats, right? That can be true of imposter beliefs. We can go through the day judging ourselves and thinking, everybody knows what a phony I am. Yep, I'm the imposter here. So it's really important to get to know what's going on with your mind. This takes us really to the topic of mindfulness, which is a very important part of resilience. And it's also a very important part of mitigating and preventing burnout in healthcare. Many of you are probably very well versed in mindfulness, but I wanted to just go over some basic definitions. Mindfulness is about paying attention. It's the awareness that emerges when we pay attention in a very specific way, a very purposeful way. And what is it that we're paying attention to? Well, we're paying attention to the present moment, this moment, right here, right now. And while this definition says that we're doing that non-judgmentally, I want to offer that we do it with less judgment than most of us bring to our thought processes. And when we are paying attention in this way, we're taking the mind away from theories and abstractions, fantasies, really. Thoughts about a future that may never occur. And we're coming back to the actual experience itself. What is it that's happening in my moment experience? And that can help us not fall prey to prejudices, opinions, projections, expectations, things that really cause unconscious and semi-conscious bias. And we can free ourselves from a straitjacket of automaticity and unconscious thinking. That's what mindfulness is all about. And this is really key in terms of building and replenishing the inner well. And so you might think to yourself, well, what is thought? Well, thought certainly is your friend. Thought is also your enemy. No one can harm you as much as unwise thought, and no one can help you as much as wise thought. So with the flexibility that I'm talking about with resilience, we're getting to know our own patterns of mind. So you've all been waiting to hear more about the imposter syndrome, and this really applies to the imposter syndrome. And sorry for the blurriness on this picture. I'm not sure what happened. But what happens with the imposter syndrome is that we think that what we know is tiny, right? Kind of as big as the tip of my pinky. And yet what others know is, as big as the city of Boston, right? We think that others know so much more than we do. And the reality is, for a similarly situated person, a peer, that there's some overlap. There may be things that that individual knows that you don't. There are probably things that you know that they don't. But it's very different than that kind of tiny sphere that we think about when we accuse ourselves of being an imposter. And we don't have really good data on the incidence of the imposter syndrome in healthcare professionals. I can tell you, in the well over 500 physicians that I've coached one-on-one, maybe there have been 4 that didn't feel like an imposter. And quite honestly, they were kind of those narcissistic, arrogant ones that we're all familiar with. But for most people, we all suffer from the imposter syndrome. I didn't put this up here, but if you Google imposter syndrome quotes, guess what? Michelle Obama, Chief Justice Elena Sotomayor, Tom Hanks, and a host of other celebrities. And guess what? Albert Einstein felt like an imposter. It's really incredible. Writers like, John Steinbeck, very famous and revered and esteemed individuals. So it's part of the human condition. The negativity bias, again, that we can focus on what we're not doing well, and that can translate into a sense of being an imposter. And while many of us believe that burnout is due to the electronic health record demands, a healthcare system that has become very corporatized, right, in this whole country, emphasis on productivity and the bottom line, all of which are very real, and of course, fuel burnout in healthcare. I'm here to tell you that some of these things, like walking around feeling like an imposter and not being able to focus on our strengths and accomplishments, wear us down. They make us less resilient to the difficulties that we face. They set us up for burnout, even though they're less obvious than things like the EMR. And so moving along on your worksheet, I want you to just write down, what are your top imposter beliefs? Is it that other people are smarter, more compassionate, more efficient, better leaders, better clinicians? And that painful part of imposter beliefs that it's only a matter of time until we're found out. And then we're exposed, right? We're exposed as the laughing stock of our institution or our community. So it's important to bring these imposter beliefs out into the light of day. It's an important way to mitigate the negativity bias. Now, the important question is, are these beliefs true? And how do you know? What makes you so sure that you're an imposter? What's the data? Is this data objective? Or is it subjective? Let's take a moment to consider these questions. And I want to challenge you to think about how you can lean into your strengths to overcome these beliefs, because they are just beliefs. In fact, they are just thoughts. They may be partial truths. I don't know any of you. Maybe they're a full truth. Maybe you're the one person, the needle in the haystack, who is truly the imposter. And maybe that's what you're sitting here thinking. Well, those other people are fake imposters. I'm the real imposter. That's what we call recalcitrant or intractable imposter syndrome. but I'm here to wiggle some of those beliefs that can really take hold in our mind, because again, the imposter syndrome and beliefs about it are simply thoughts that we have about ourselves, and thoughts are transient mental events, transient synaptic firings. They arise, they float through our consciousness, and then they dissipate. Every thought you've ever had is like that, relatively insubstantial when you focus on it, and yet think about all the attention and the kind of the merit that we give our thoughts. Again, some of that makes sense. For me as a physician, I've really come to understand that our training is very biased. Our training doesn't teach us how to question our thoughts and how to work with the ones that really are not serving us terribly well. And I've given this a lot of thought. I almost feel like I was put on this earth to help vanquish the imposter syndrome. And I've developed this little cycle that I call the cycle of perceived inadequacy. Let me run through it. You can see what you think. What do? Well, we tend to focus or be hyper-focused on things we perceive we didn't do well. Yeah, I didn't sound very smart. I'm not very articulate. I didn't give a very good presentation. We compare ourselves with our peers, but what are we hyper-focused on with them? Well, we are hyper-focused on what we perceive they did do well. That one was so smart. She sounded so articulate. That one, he gave such a great presentation, right? So we kind of create this delta, this perceptual gap of where we believe we are and where we believe the object of our comparison is. We magnify this sense of inadequacy, but we don't stop there. We go round and round and round in this hamster wheel of a cycle. Now, in healthcare, I believe that we try to be fairly objective, don't we? We pride ourselves on our objectivity. And yet, I really want you to think for a minute, is this an objective cycle or is this a subjective one? Just take a moment. And perhaps you can put anything in the chat related to some of these questions about how do you know your imposter beliefs are true? Whether you think this cycle makes sense. Does it typify some of your mental patterns? And whether this is an objective or subjective cycle. Because the fact of the matter is that we all do this. And you can be sure the object of your comparison, this person that you've decided is smarter, more able, better clinician, more efficient, pick your poison, that they're in this cycle as well with their own object of comparison. And this ties into a concept that comes to us from the field of cognitive behavioral therapy, the idea of cognitive distortions. In other words, filters that we have. We all have them. Filters through which we look at ourselves and the world around us, and filters that distort what we see. So you can see a couple of these filters here: magnification, and obviously its sister, minimization. So we're magnifying what we perceive we didn't do well, and we're minimizing at the same time. We engage in mind reading. Even all of us, very bright people, top of our game in healthcare, we think we know, oh, they can see what a phony I am, right? As if we could ever know what anybody else is thinking. We engage in all or nothing thinking. I'm either fantastic or I'm a failure. And we filter out data. So in other words, I'm giving this talk right now. I can only see a few of your faces. Maybe some of you are looking down at your devices, and I could really go to town with my imposter syndrome. Gosh, they're not finding me very interesting, are they? Maybe there's somebody who's making great eye contact, but I might filter that out if I'm really giving the imposter beliefs too much of my attention. And then we can be our own most harsh critic. We can say things to ourselves that we would never say to somebody else, let alone to somebody that we cared about. And here one person writes, I often find that I doubt myself, my education expertise, and find myself less than, especially when I have to go up to people in leadership to pitch my ideas. Now, this is a brave individual who wrote this. I hope that you have on your lists of strengths that you have a lot of courage, because look, none of your peers have written anything? And I mean, we could do a show of hands. Again, maybe all of you. It must be different in California than in Boston. No imposter syndrome? Or is it that it's hard to own up to? Okay, look at that. Yeah, put your hands up. My name is Gail. I suffer from the imposter syndrome. I teach at Harvard Medical School. All of you teach at prestigious institutions. It's really easy to feel like an imposter. Look at this. Okay, look at this. Very courageous for each of you to do this. So take a look at this. Is this everyone whose hands are up now? Yeah, we're all walking around feeling like imposters, and the wear and tear of that, it's really tremendous. How could we not feel burned out? I've coached so many physicians struggling with documentation. You know, the Achilles heel for all of us in healthcare is the care and feeding of the EMR, right? And I can't tell you how many physicians have told me that they sit down to chart at the end of a long day, they're exhausted, and they've got a lot of charts to get through. And guess what goes through their mind? Yeah, I don't really know what I'm doing. Everybody else, much better doctor than I am, so much smarter, so much more efficient, so much more this, so much more that. And, you know, sometimes they're going to find out and then they're going to kick me out. Whew, and that's not going to be good. And then we wonder why we can't get our charts done. Okay, so this is workable. Just seeing everybody with their hands up. I want you to have that image the next time your mind gets overly attached to something that is just a thought. I really want you to think about this moment. Somebody else wrote, on the flip side, I also feel imposter syndrome when I'm giving lectures to residents. Yeah, who were my co-residents last year. Sure, we all have our triggers for feeling like an imposter. And let's face it, young people are smart. It's easy to feel intimidated by new learners, isn't it? Okay, so a little bit more about mindfulness. You heard that I myself am a certified mindfulness teacher. I've had a long-standing meditation and mindfulness practice, but really more importantly, we have a lot of data that shows that it can really help mitigate burnout. We have hundreds, if not thousands of studies about high levels of burnout in physicians, in nurses, in pharmacists, in really every discipline. And we have much less data about what on earth to do about it. And in that paucity of data, the most promising research is in the area of mindfulness, where we learn to work with our thoughts. I really want you to hear me, that the imposter syndrome is just a thought process. That's all it is. We have the choice how much attention we give to any of our thoughts. And that's what mindfulness helps us do, that awareness that comes from paying attention to what is going on right here in our own minds. Our minds, again, are busy places. Meditation is not about banishing thought. It's about changing our relationship to thought, giving us more agency over our busy mind. When we're mindless, we're on autopilot, and we all know that, right? We get in the car, we drive somewhere, and we get there and we think, gosh, how did I get here? That's autopilot. We get to the end of the day. Gosh, what did I have for lunch? Did I even eat lunch? You know, the day can be a blur. That's mindlessness. Lack of awareness of what's going on in each and every moment. The mind flitting about, reliving the past, rehashing an argument, going over a challenging case, right? Or jetting off, to the future. Worries, fears. What if I get COVID? Right? Are my children safe? What's going to happen to them? Gosh, you know, what's going to happen with that difficult shift that I have next week? So it's not that we can't think about the past or the future. It's, again, having more agency, being very intentional when we want to replay a difficult case because it's an opportunity for learning and growth. And when we want to reflect on the future, perhaps planning some wonderful event or thinking about how we're going to meet a challenge that we have next week. It's all about having that kind of agency, which leaves us feeling much less stuck, rigid, and judgmental. And I think this pictorial can be helpful, that when we're mindless, we're almost like a marionette, right? Something happens and we respond like that. And we wonder, gosh, what happened to me? You know, this is true of emotional reactivity, that something happens, somebody says something, maybe a partner or kids or a coworker, and we just like are, you know, we're kind of smoking mad or irritated or frustrated, and we respond and we regret it later on. With mindfulness, it's the exact same stimulus. Stimuli are coming at us all day long, every single one of us. But what's different here is that we have that awareness. We're aware, gosh, I got triggered by what that person said. Whew, I think I better pause and take a few slow, deep breaths. We realize we have a choice. Sure, we can respond, we can get angry, we can kick ourselves afterwards, or we can respond from a more professional and staid place. And of course, that's when we look back and feel good about our response, whether it's as a parent, as a clinician, in any other realm of our lives. This is what mindfulness can offer us. That's what we're doing with mindfulness. We're learning to be aware of what the mind is up to. Why? So that we can work with it with much more skillfulness. So many benefits of mindfulness. This is just a short list here in terms of the many varied benefits and thousands of studies thereof. So that's what I wanted to talk about with flexibility. And I want to move now to the area of self-regulation and positivity. One way that we can build accurate and authentic and realistic positivity is with gratitude. There are other ways. Savoring good things that happen in our day is another way, right, to build positivity. As we did that exercise with our strengths, really reflecting on what we're doing well, perhaps at the end of the day, instead of going over the to-do list or the not done list, actually go over 3 things that went well in the course of the day. That's another way that we can build positivity. I want to just do an exercise right now to help you employ gratitude to fill your well of resilience with more positivity. And I just want you to bring to mind someone that you appreciate in terms of the positive impact they've had on your life. It could be a family member, a mentor, a partner, a colleague, a child, anyone really, living or deceased. And as you think about that person, I want you to just write briefly in sentence form, bullets, whatever comes easiest to you, as if you were telling this person about how much you appreciate what they've done for you and how they've helped enrich your life. You don't ever have to deliver this letter, but it can be useful simply to write. Express your gratitude to this individual as if you could actually speak to them. What is it that they did that had such a positive impact on your life? What is it that you're so thankful for? Let's take a few moments here to jot that down. And just notice what your experience is as you're writing this. Just notice if there's a sense of warmth or ease, possibly a sense of relaxation physically and mentally. There could be tears as you reflect on this individual and really what they did to help you get where you are in your life. Gratitude isn't about a false sense of goodness or appreciation. It's about an authentic sense. Because whatever it is that we don't have and that we want more of, we always have a lot here already. Whatever physical limitations each of you might have from illnesses or accidents or congenital issues, there's still a lot that's going well and working well in your body, isn't there? Negativity bias kind of latches on to what isn't going well, and what we're doing in building resilience is really replenishing that inner well. helping to move the focus to some of the goodness that is actually always here, no matter how difficult the circumstance. Many of you are aware of silver linings over the last year in the setting of all of the illness that you've seen, all of the difficulty, all of the change and uncertainty. There have also been silver linings, I think, for many people. And since we don't know what the future is going to bring, right, we never can, really leaning into gratitude is a very important way to fill the inner well of resilience. And if you want to comment in the chat, please feel free. Anything that you noticed. Again, you don't need to deliver this letter. This is an exercise, and this is really a proven strategy for building authentic and realistic positivity. But if you have any reaction to it, I think it'd be helpful for others to see. And when we think about resilience as well, we need to really think about what can we control? What can't we? There's so much in healthcare that's out of our control, right? I don't think we needed COVID to tell us that, but it's certainly prime center, so much that is out of our control. And yet we can find ourselves expending a lot of energy on things that we can't control, worries, fears, ruminations. So it's important for resilience to think about, well, I'm worried about something, but what parts of this can I control? How much is that worry changing anything? It's also important for guilt that we may be experiencing. So many physicians during the pandemic, so much guilt, and obviously not just for physicians. Guilt for people that we couldn't save. Guilt if you're in telehealth and feeling like you weren't on the front lines. And yet, I imagine that each of you has been doing a lot of good every single day of the pandemic and much more. So with resilience, we just want to have clarity. We really want to challenge ourselves. Is this something I can control or is it not? And so this is kind of a bonus resilience strategy that I'll throw in. It's to develop a practice of letting go, of realizing where we're getting caught mentally, where we are dissipating our precious energy in things that we can never change or control. So we can use meditation as a way to let go. It's almost like breathing in calm, breathing out, letting go, let's say of a worry. Breathing in ease, breathing out something that isn't helping me to perseverate on. I want to encourage you to try that out. And lastly, I want to talk about self-care, particularly through the lens of self-compassion. We can be our most harsh critic, can't we? Whether it's accusing ourselves of being an imposter, not smart enough, not attractive enough. Name your poison. You can fill in the blank with a lot of different things that we can be very, very harsh with ourselves about. And so another aspect of resilience is building the muscle of self-compassion. Kristin Neff is one of the global leaders, one of the key researchers in a very growing area of neuroscience and self-compassion. Very simple. She says, well, what would you say to a friend or a family member who is struggling in the same way? That's a way that we can build the muscle of compassion toward ourselves. For so many of us in healthcare, we learned we're there to take care of others, right? We put our needs last. And then we don't have time because we're so busy taking care of others, both professionally and personally. So I want to just lead you in a brief exercise right now. I'd like you to bring to mind whatever your top challenge is. Perhaps it's one that you reflected on in the breakout rooms. Perhaps it's another one, but just bring it to mind right now. And don't go with a 10 out of 10 challenge, more like a 3 to 5 out of 10. But just bring it to mind right now, whatever it is that you're struggling with. And if there's nothing that you're struggling with, well, you can just take a pass on this exercise. But just bring it to mind. And I'm just going to lead you in an exercise called a self-compassion break. If you could put your hand over the area of your heart, or perhaps a hand on your cheek or on your hair, just a gesture of self-kindness and really kind of put some pressure there, just as you would put the arm around a friend if you didn't have to socially distance. And I'm just going to say some things about the difficulty that you're going through. What you're going through is hard. This is really challenging. I can really imagine why this is causing so much stress for you and so much difficulty. Other people experience the same challenge. Certainly, if what you're thinking about is an imposter belief or difficulty during the pandemic, you can be sure that other people are suffering with this in the same way. We all suffer in life, small or large. We all face difficulties, even though we can often feel like it's just us and we can go to poor me and why me. It actually isn't true. We're all vulnerable to difficulties, challenges, and suffering. And as you keep your hand pressed over the area of your heart, I'm going to say some things, and I want to invite you to repeat them mentally after I say them. May I be kind to myself. May I be patient with myself. May I bring the same compassion to myself that I bring so readily to others. May I forgive myself. May I remind myself that I'm an imperfect being amongst other imperfect beings. May I care for myself just as I would care for a dear friend or a loved one. And may I live with many, many moments of calm and ease. And take a few slow, deep breaths right now. As I say these words again, may I be kind to myself. May I be gentle with myself. May I be patient with myself. May I forgive myself. May I remind myself that I'm an imperfect being amongst other imperfect beings. May I bring the same compassion toward myself that I bring to so many others. And may I live with many, many moments of calm and ease. That's what's known as a self-compassion break, and I've included those words as well as some research citations and links. I've included that on your handout, and I really want to encourage you to use self-compassion breaks. We've covered a lot of ground, and as I said, much of this is from the book that I wrote, and I offer a free chapter if this can be helpful to you. So maybe we can include the link either in the chat or Alana, perhaps that can be sent out afterwards. I also have a free mini mindfulness course. You know, there's so many resources now in mindfulness, but there aren't that many that are specific to healthcare. And I've seen what a need there is amongst colleagues and coworkers. So I developed this 14-day mini course. It's 10-minute bites, an audio where I give a talk, a brief talk on a mindfulness topic, and then I lead a guided meditation. So if that can be helpful to you or to anyone else that you know, please feel free to download that. I've also recently started a Facebook group called Everyday Resilience. It's been very, very popular with physicians and others in healthcare. So you can just go on Facebook, put in Everyday Resilience, and I will happily approve you joining the group. So Thank you so much for your patience and your attention today. We covered a lot of ground. We talked about what resilience is and how important it is to learn to overcome the negativity bias by intentionally focusing on your strengths. And I want to encourage you to keep the list of strengths that you developed in your breakout room and really think about, gosh, how can I use these to meet the challenge that I'm currently facing? We talked about mindfulness and some basics, the idea that thoughts are simply thoughts. They're not facts. Whatever our mind tries to convince us, they are not facts. They are transient, insubstantial mental events that come and go. And we have the choice. We can learn to decide which thoughts we focus on. And in particular, we can harness that to overcome the mind's tendency to accuse us of being an imposter. Similarly, we talked about gratitude, and you can go back to that letter that you wrote. Times when you're feeling down or overwhelmed, you saw what changes you experienced when you tapped into gratitude. And then lastly, we talked about self-compassion, and you have the script there for the self-compassion break. Alana, I think we probably have 2 winners. Maybe you can unmute yourself and tell us who they are.
Yeah, the 2 winners for the session are Julie Johnson and Vivian Yang.
Wonderful. Well, the 2 of you will have to get up early on Saturday the 17th. But you'll be joining us in the Imposter No More workshop, and I really look forward to seeing you there. So I think we just have a few minutes for questions. Again, please connect. Any questions? You can unmute yourselves or you can pop it in the chat. I know you're all eager to get to lunch. Wonderful. Well, please feel free to reach out to me. My email is there, info@gailgazelle.com. Happy to be a resource about resilience. So please don't hesitate if I can be of service to any of you. Send a link to the Facebook group.
Yeah.
Got it. Yes, I don't, might take me a minute to pull that up, but if you just put in your Facebook in the search bar, Everyday Resilience, it'll pop right up there. Thank you so much, everyone, for being here. I really hope you have a peaceful and productive day.
Thank you so much, Dr. Gazelle. I think that was just such a timely and important presentation. And thank you for providing some concrete skills and resources that we can take with us moving forward as we combat imposter syndrome and try to build resilience during these difficult times. So thank you again. There's a lot of enthusiasm about the resources you shared, so we will make sure to compile them and follow up with everyone after the conference as well, so that we all can benefit from those resources. Thank you.
Thank you so much. Really been a pleasure.
Our next presenters are Mike Miller and Muriel Benares Miller of Brown Miller Communications, or BMC. BMC has been a partner since the inception of the Champion Provider Fellowship. As many of you are aware, BMC has many important roles, including providing key messaging support and media training for fellows, in addition to serving as our technical assistance leads for local health departments. Mike Miller is president and founder of BMC. He has spent the last 25 years working with the media, the public, and policymakers to help shape public opinion and motivate positive social change. Mr. Miller works to raise awareness on issues ranging from the crisis surrounding the health of farm workers to America's emerging obesity epidemic. His skills as a strategic communicator have helped to address a broad list of critical legislative issues, including his media support of efforts to remove unhealthy foods and beverages from schools, and his campaign to win support for menu labeling legislation. For his work to address nutrition and health issues, Mike has been awarded the nation's highest public relations honor, the Silver Anvil, on 4 different occasions. Muriel Benares Miller is a veteran communications expert specializing in consumer health education and multicultural communications. Ms. Benares Miller develops and manages integrated communications campaigns aimed at educating consumers and changing and improving behaviors. She directs audience research, discerns areas of opportunity, and crafts unique strategies to influence and educate specific audience segments. In many cases, this means addressing varying language and cultural issues among key populations and subpopulations. Her execution of the award-winning comprehensive social marketing campaign, Steps to a Healthier Salinas, resulted in groundbreaking and lasting health improvements. Thank you both for being here, and I'll turn it over to you for our social media training.
Mike, you're on mute.
Thanks, Ragata. Sorry about that, everybody. This was a session that we were especially interested in introducing the providers to, the fellows to, because we see this over the years, we've seen this, the possibility, the potential, as well as some of the risks related to social media emerge. And we wanted to make sure that as fellows, you were fully prepared both to take advantage and harness this, but also to know some of the danger spots that you might step into. So we wanted to, in a breathless hour, we wanted to walk you through an introduction to some of the social media opportunities, but most importantly, we wanted to show you how to maneuver through this so that you can harness it and use it effectively, but also avoid getting taken down, because there are some pitfalls in all of this. Next slide. So Muriel and I were talking after Dr. Gazelle's session. It's like, we feel like we need to apologize right off the top. Hers was such a calm, meditative, and relaxed pace, and we have a lot to introduce you to. So I'm going to tell you right off the top, there's quite a few slides here. You will be able to download those later. And there's some good information we think in there that could be valuable for you. But we're going to move through this fairly quickly because what we really want to get into is we want to introduce you to social media, the types of social media and how to use them. But we really wanted to spend some time on how to protect yourself in a social media environment and how to take full advantage of that media environment. So we'll go through this fairly quickly, and I'm going to turn a lot of this over to Muriel, who is our social media expert. So she'll be able to address a lot of this for you.
Thank you, Mike. So like Mike said, we're going to be covering a lot of ground in a very short period of time. So what I'm going to be doing is introducing everyone with what is social media and giving you a quick overview of what they are. And then Mike will later go over how to use social media. So what is social media? So basically it is content sharing. This is where you can build relationships. This is where you can influence. And this is where you can engage. You can use an authentic voice. This is the opportunity to be a thought leader. Also encourages a two-way communication and sometimes data collection, research. This can also lead to direct action and sometimes engagement. It also is an opportunity to reach an audience that you never thought you could reach before. I wanted to kind of show you the difference between the traditional media versus social media. And the benefits of traditional media actually is that it establishes the story or the news. It is vetted, meaning that these news are fact-checked and carefully put together. It is resourced, it is credible, and like I said, it is researched. For social media, the benefits are it's free. It is open to anyone, so access is open. You have a wide reach. It replicates, meaning that you're able to share it easily. And it's an echo chamber for when there's something that means something to you and you want to go ahead and keep saying it. The flip side to this is that if you go back to each and every one, the disadvantage are pretty much on the other side. So with, like, for example, for social media, it isn't vetted. So it's easy to share something that may or may not be true because it's not fact checked to the point where a news story may be. So if you were to flip, there are the advantages and the benefits, but on the other side is your disadvantages.
Yeah, and I'd just add, I think if I were to look at a universal picture of this, traditional media, and we're talking about your newspapers, television, radio, that this is going to be much where news is generated, where the actual news happens. And then when you flip on over to your Facebook and your Twitter and your Instagram and social media, that's where commentary takes place on it. So that's really the difference. One is where news is largely established, and then people comment on that news on the social media side. Not exclusively, there's nothing completely clean about that, but that's largely the best way to understand the broad differences of the two. So the reason we wanted to spend some time on social media is there are huge opportunities with social media. As Muriel said, there's enormous reach and there's next to no cost, no fiscal cost in taking hold of that reach and moving things forward. The flip side is it's a dangerous environment because there is no policeman on the corner to watch what you're doing and maintain things. You probably have all seen there's trolls out there and conversations can go askew and things can get very ugly very fast. And we wanted to introduce this to you because I think it's important that you do know there's incredible possibility for you all as champions to work in social media. What's really important is you have to do it with your eyes wide open. And so that's the whole purpose of this session is to give you an understanding of how to do it and to understand how to protect yourself in the process.
So what I'm going to be doing is introducing you to the different types of social media, and there's a lot of them out there.
Yeah.
This will kind of give you a better sense of what they do and which one will be best fit for your storytelling needs. So I'm going to go over the different types here that I have identified. Social networking sites. So most of us are familiar with social networking sites like Facebook, Twitter, LinkedIn. So these are platforms that help us connect with friends, family, brands. They encourage knowledge sharing and are all about personal and human-to-human interaction. A social networking site is a jail of all trades. Users can share thoughts, they can curate content, they can upload photos and videos, form groups based on interest, and participate in lively discussions. They're built around the user, everything that's important to them, and their social circles. Again, this is where you connect and network. So with the social review sites, this is where you do a lot of research, because what's the first thing you do when you're planning a trip or you're buying a new product? You want to know what other people are thinking about it. You want to know what to do before you even decide on something. So these are very important in terms of research. If you want to understand other people's perspectives, what they think about it, how to solve problems, and then if you're the business, how to promote your business or help to solve some issues that may come up when someone's not happy with your business. The next thing is your image sharing sites. This is the Instagram, the TikToks, the Snapchat, the Pinterest. This is where you share, where you say a picture is worth 1,000 words and you let the image speak for itself. You want it to just spark conversation. This is a user-generated content. That means that you share your image, and for a lot of people, this is used to create inspiration. A video hosting site. This is where you have to share phenomenal content, meaning there's a lot of work that goes into production. This has to be scripted a lot of times so that when someone actually engage in this, they are fully committed, taking on videos and Vimeos. You have to want to get to that content, but this is where you have engagement. This is where you educate, and this is where you can persuade. Community blogs like Tumblr. You have Tumblr. Medium, and I believe these are personal blogs. Sometimes your posts on Facebook or Twitter are just not complex enough for the message that you want to send out. So you want to go to a more involved places. And sometimes this is where you go, a community blog, because you don't want to spend a lot of time creating your own and hosting your own personal blog. That is a lot of work. So you go to a shared blogging platform like these. You share your expression. This is your space for sharing your thoughts and expression without having to deal with setting up your own blog, having to do all these things. This is also where you could start to develop your own voice. It is syndicated, which means that it is shared to a lot of people. And again, you can reach a lot of people this way if your content is important to them. Discussion sites are interesting because this is where conversations start. This is where people go to if you're not looking to the blog because you think it's too much to read, you have a quick question. And I know some people sometimes confuse this with like the review sites. This is more where you ask questions and you research and you say, hey, my dog is missing. Can someone keep an eye out? And this could be very local, which is very important because then if you wanted to reach someone that is local to you, you can exchange information. You can even educate and persuade in a more local environment. And I think that's pretty much. Sorry, I took you guys through all of that really quickly. We want to get moving on. Mike will tell you why we should use social media.
And I'll, fair warning. I have always been a curmudgeon about social media. I'm not the world's biggest fan, but I also have seen it evolve, and I've seen how powerful it can be, and especially from a champion's perspective. I know that there is real opportunity for you here. It's a great way to share information because there is no guardian at the door. You can post without having somebody have to decide if this is appropriate information or if this is something that the audience is interested in. There is nobody guarding that. So it's a great way to share information. I like to use social media to monitor public opinion. So even if you choose to never actually post anything on social media, I would encourage all of you to think about signing up with accounts like Facebook or Twitter, simply so that you can see where your community is on these different issues. You can read it and start to get a feel. We have to do this all the time as communication specialists. And it is a very effective way of getting a pulse. You have to be able to sort out I'm going to use the word trolls all day long, but you have to be able to sort out those trolls because they are the exception. They don't represent the population, and they tend to be very vocal. But when you read through these, you start to get inklings of where people are at on different issues. If we're talking about a Rethink Your Drink campaign, you'll hear and see comments about this, and you'll start to get a measure of how people are feeling about this and where their attitudes are, and that's very helpful. Social media also helps us build networks. It's amazing how fast you'll get followers because people follow those who share the same attitudes that you have. So you can build there, or you can find out who your supporters are with different ideas like this. We also, you can build relationships. That's a little bit trickier, and I'm not going to go too much into it because I don't think that's as important in using social media. There's better ways of doing that. And one thing that we have found is that the news media will farm social media sites to find out who opinion leaders are on different issues. And they'll turn to them and ask them for comments. This is new. This has only been happening in the last 5 years or so. But we've seen that the media does look for good, reliable sources, and they will farm them out of social media sites for those who are commenting. So it's a place where you can start to build yourself as a source. I think most important from a champion provider's perspective is this is a valuable place for you to become an educator and to inspire people. to start to move them towards advocacy as you move forward. So it's one of the things that I would like to encourage all you to think about, and there is risk with this, and we'll talk a little bit about this, but there's a lot of misinformation on social media platforms. Those trolls are very effective in convincing everybody of their perspective, which is often not scientific, it's not research-based, it's just their opinion. And there is a role for you to play in simply surfacing good scientific information, so that there is a counter to some of the trolls out there who are using the social media platform and pulling a lot of unsuspecting people into the wrong direction, and there's nobody challenging them. I don't want you to be in a challenging position, but I do want you to be in an authoritative scientific or research-based position to be able to give them good information. Right. Next slide. So how do you use social media? And despite the fact that Muriel screamed through a bunch of those, we've chosen a few that we think are the most appropriate for you as champions to engage in. So we're going to spend a little bit more time talking about them. But first and foremost, it's a lot of what we've talked about for any of you who've been through any of our communications class. You have to know your audience, and your audience changes from one social media platform to another. Different platforms attract different people, and you need to be aware of that. You should not go into social media unless you know why you're going in there and you have a plan on how to use it. And I'm not talking about if you want your personal life, that, you know, your Facebook with your friends and stuff like that, that's fine. But when you're thinking about social media platforms as an advocacy platform, you really need to be very thoughtful about what you want to do and what you want to achieve and how you're going to go about doing that. And we'll talk a little bit about that in a second. You also, as I mentioned earlier, social media should be a place where you can monitor conversations, where you can get the pulse of where your community is on the issues that you're trying to move forward. It gives you an opportunity to have a voice and a tone on different things to reshape conversations that may be happening in your community. And in order to do that, you're going to have to be active. There is a time commitment to this. You've got to be looking at that Twitter feed or your Facebook feed on a fairly regular basis to get a sense of where the community is on this and know how best to respond to all of that. Okay.
Here, we're just kind of giving you prompts and to really understand and to know who you want to connect with and knowing your audience. And these are just simple questions like, who do you want to connect with? I mean, is there an age group? Just start asking yourself questions. Do you want to stay local? Do you want to go regional? Do you want to go national? Those will have different needs. Maybe their interests are similar to similar interests. And there are ways of doing that with platforms like Facebook and Twitter. Maybe you want to think about certain challenges that they have in their life and in terms of stages of life, whether they're aging or whether they want some type of support group. So these are locations and audiences that you could start to think about when you're looking to do a plan of action of how to use social media. And this is where we want you to, there's so many platforms out there that it's so confusing and it's overwhelming that it's okay to maybe pick and choose 2, maybe 3. I myself get very overwhelmed with social media. There's so many things. Just joined Clubhouse and I said, okay, now what? It's all about choosing where you can find a voice. A lot of times all I do is, like what Mike said, is monitor, just to get a pulse of what's out there, how people are talking and how they're sharing information. So I'm gonna briefly go through 3, we've chosen Facebook, Twitter, and Instagram for you because these are the largest share of social media platforms. And I'm going to give you some benefits and some best practices on how to use these different platforms. So for Facebook, why use Facebook? This is actually the largest market share in the world. There are active monthly users in any one country's population worldwide. You have 1.4 billion daily users and 2.13 billion monthly users. That's a lot of people to reach. And and I don't know how old this, and it may be a little bit older, but 25 to 34-year-olds are the biggest segment for US users, and 75% of the US adults make up more than 75,000 users here. Facebook is really best for information sharing. I have seen, this is where families share photos. This is where families share information. This is where someone also says, hey, I need to know, I use Facebook groups. I follow certain groups that I'm interested in. I want to know what's around me. I want to hear what's going on. I'm in a school Facebook group so that I know what's happening with the school. It's really shifted the way we receive information and how we communicate with people. The one thing that Facebook does have that is great is if you're a business, there are calls to action that they provide and can lead people to the next step. Either it's visiting a website or having, contacts with them, or being able to send a letter to an official or legislator, sharing with friends, knowing events around you. You can donate, you can fill out polls, but there is a disadvantage to social media, and that's overcoming algorithms to reach audience.
And Muriel, if I could, I just wanted to accent something. I really think this is important to understand that, again, as champions, there is this opportunity for you to use Facebook as a call to action. So getting people rallied around an issue, writing letters to the school board, showing up at meetings, all of those are things that Facebook can be very effective at, especially if you've created a Facebook group around a certain issue that you are advocating towards. So keep that in mind. It's the reason that we wanted to pull up Facebook as an important tool that you may want to consider. Sorry, go ahead, Muriel.
No worries. The downside to Facebook is that there's algorithms to it, and you can only reach certain audiences. They have limited you. It's based on who you interact with, and sometimes you do have to overcome that. Sometimes that has to do with Facebook ads, but we can go further than that later. Some of the best practices for Facebook: 1 post per day maximum. Too much becomes spammy. Be concise, 5 to 75 words if possible. If it's longer, it must be punchy, kind of like thinking about above the fold type of thing. Always include a link to your action items or the call to action if you have it, but always think about your solution and your action. Take advantage of visual elements. You're talking about photos, videos, image previews. Sometimes a text post is kind of bland, and so you want to attract the eye. And so this is where you start to look at adding a punchy photo. Clip arts, I don't recommend, but something that catches your eye is always helpful. For Twitter, this is where it's fast, it's furious, but it's also it's high quality. I think that this is where you can grab audiences. It can be funny and humorous, and the content can be engaging. It's also where you can interact with someone to influence, like a reporter, or to reach out to your legislator. I think they do pay attention if you kind of tag them, meaning like at such and such, or you use hashtags. They will look at that and they will respond for the most part.
Yeah, I would really emphasize that too. I think that elected officials at all levels, from school board on up, almost all of them have a Twitter account and they use Twitter, and they are they can be heavily influenced through Twitter. They see, they may get 20 comments, but they see those as being largely representative of their entire community, whether they are or not. So it's something to keep in mind.
Right. So just some basic facts here for Twitter. You have 330 million active monthly users, and 45%, almost half, have college degrees. So that kind of gives you a sense of how they use this. It allows for, and like, this is what we're talking about, the direct communication. You can message them, or you can, have it on your post and tag them on your actual post, and they will most likely respond. This is actually how you get through some very big companies. This encourages conversation between community leaders, elected officials, and journalists, and you can insert yourself. This is kind of important. You can insert yourself in relevant topics through the direct responses to your accounts with your champion provider hat. The only thing is that with Twitter, it would require you to do a lot of posting to reach followers. Like, people will have to get to know you. Again, it's the algorithm thing. The more you're out there, the more you're seen. And so with that, the best practices is, if you can, post one per day for consistency. Being concise, it is only allowed 120 characters, but 240 characters, like two Twitter posts max, in terms of getting your thought across. Links, actions, visuals, always helpful. If you're not aware, you can always shorten your handle. If there's links and the links are too long, try to use like bit.ly or something to try to shorten it. Use one or two popular hashtags to reach new audiences, and the hashtags will be about the topic that you're interested in, and those will start to what you would call trend if it's popular enough. Have conversations with people and organizations to have followings, and this is where you insert yourself to try to echo or echo their either support or education about this particular topic. And then with Instagram, I'm going to quickly go through this one. Instagram is great, and we chose this only because it is connected with Facebook. Facebook and Instagram have, they are in one platform, but not, they're together. So you can do advertising on Facebook and Instagram and you can actually share posts between the two. Because they seem to be owned by Facebook. The only thing is, with Instagram, this is very image based. You have to be very careful with sharing on Instagram and making sure that you have high quality images. Nobody wants to see blurry images on Instagram. That is not what it's for, and it has to be impactful. You have 1 billion users. I know that the younger audiences love this platform because of the imagery and the video. You have 43% African Americans, 38% Hispanic, and 32% white. You can do direct communication through direct messaging, as with any of the other ones. You can encourage participation in experience via post tagging, story sharing, the video reels, and that's the IG Live. And then you can reach new followers through the use of hashtags similar to the other ones.
I think as we look at these three, though, it's, we offered up these three examples, Facebook, Twitter, and Instagram, because they reach different audiences. They use different platforms to try and attract a different group. And if you want to, we work with them all the time collectively. So we will have a post that's for Facebook. We will revise the post and make it and change it so it's more appropriate for Twitter. And then we'll find a great image, hopefully, and use it as well in Instagram. So we are looking at a collective approach. You don't have to do this, but I think what we're hoping you do is you think about your audience as you look at that. Which is the right platform for the audience that I'm trying to reach? And if you are looking for youth, younger group, it's going to be Instagram, maybe Twitter. It won't be Facebook as much. As you're looking to bring in parents and professionals, then it may be probably jumping up to Facebook and Twitter. So you need to think about that. We wanted to put that out there so you could understand that each of these platforms reaches a different audience, and you have to communicate slightly differently with each one of them.
And with that, like Mike said, in order to be successful with social media, you have to set your goals. You have to do your research, monitor what other people are doing, really conduct an audience with yourself. Who are you connecting with? Who's connecting with you? Understanding which networks are attracting the audience you want to reach. And then how do you compare to your competitors if you have one, or someone who have similar interests? And then you want to ask yourself, is the audience here? Like, are they on Facebook? Are they on Twitter? Are they on Instagram? Or are they on probably on TikTok and Snapchat? Then how do you manage that? And so you want to be understanding of which one will get you to the right place to get your message across. And so you really want to know, how does this help achieve your goals? And then again, the use of hashtags. The hashtags are important because they're kind of broad. And so they're like this net that you set out there, and it captures very general audiences that may have said, oh, I didn't know about this organization. Maybe I'll look into that.
I'm loving all the comments. I'm having more fun with the comments on the side here. It's like, oh yeah, these are fun questions. There's two things though. So Muriel just gave you the entire universe of social media in 17 minutes. It's a lot to digest, and it's a ton of information. And again, the slides will be available to you. But from a champion provider perspective, there's just two things I want you to think about. You're either going to engage on social media by creating posts or by commenting on posts. Both of these are very powerful approaches. Either one is great, but I want you just to understand that that's what we're talking about. The only subset to that is the sense of monitoring posts as well, just so you have an understanding of where your community is and what kind of dialogue is going on around whatever program you may be advocating for. So those are the two main areas that you may be engaging in. And I wanted to give you some rules of thumb on how to engage without putting yourself in danger, and with respecting the importance of your position in the community. So if we can go to the next slide. This is really, I think, these are some of the codes that we have for ourselves when we're doing social media work for our clients. These are just the things that we always are asking ourselves and trying to prompt ourselves to make sure that when we're creating posts, that they're powerful, they're appropriate, and that we're protecting ourselves in doing them. So when you're drafting the messages, you have to think about why and what is the benefit to the person. All of you who've been media trained have heard this before. It's all about the why. That's just good communications, and it certainly matters in social media. If the reader can't find the value to them, there's too many other social media posts that they're going to scam right onto to the next one, or skim right over to the next one on. So really think about the why is this of value to the person that I'm hoping will read it. And anytime you draft something that says you, think about how you can turn that around to we. Social media is by its very nature supposed to be social. We're supposed to feel inclusive. So thinking about the we instead of me or you is the language that works in social media. So instead of what is your issue, it might be how can we help? So it's really looking at this from a community perspective. Whenever possible, try and stay away from the passive voice. That's just good writing etiquette. And this is something, the trolls are out there. The trolls are prepared to condemn anything you say and everything you say. They are going to be preachy. They are going to, this is their reason for existing. And I honestly wonder if any of them do anything but troll all day long, because we see their names over and over and over and over again when we look at different channels that we get into. There's no value from your perspective of being preachy. What you want to be is supportive. Most importantly, you want to be informative and educational. This is where you stay on safe ground. As long as you're presenting good, solid information without getting into the dialogue that trolls will try and drag you into, you're going to be the most successful in social media. And from that perspective, I would encourage you always to try and cite and link as much information as possible. It is amazing. Again, we're doing a lot of work on COVID right now. Our office is doing a ton of work on COVID right now. We are constantly trying to overcome the trolls out there with their information about how the vaccine is going to change your DNA or it's going to sterilize you. We don't want to be in this conversation, but we know if there isn't a scientific response to this, too many people are going to start to, if not believe that troll, they're going to start questioning this information. You can have a huge role in just being there to provide consistent, solid, reliable, researched information for people. And as dentists and physicians, you have a level of respect that troll can't hold on to. So I really want to encourage you to think about that and protect yourself as much as possible by citing whatever you say. Even if it's a long citation, if they have to go to 3 journals, people suddenly respect that information as being solid. Okay, next slide. And just as some rules of thumb on when and how to comment. So as I mentioned, there's good reason. If you don't want to initiate the conversation, which I totally understand, and Marie, I saw you were saying several of you don't, diving in to start the conversation, I'm not a huge advocate of as much. However, commenting to correct and inform is really powerful. So when you see that information that's going in the wrong direction, that's where you can have a very powerful voice. I've got to tell you, there is no value in getting into a spitting match. The trolls love it. There is nothing they enjoy more than the flash back and forth of you said, she said, he said, she said, and you're screaming and yelling at each other. It doesn't do anything. It undermines your credibility, and you want to walk away from it. Let them call you whatever they want to call you. Just ignore it. It will dissipate in about 2 minutes. People will have moved on to something else. What they hold on to is good information, because as Muriel said at the very beginning, people are moving to social media sites for information. It's a little scary that that's a reality. The really scary thing is there's not enough of you out there to make sure that they have that information. Again, as I said, cite existing scientific information, always a good idea. And it's nice if the messages sound like there's a real human behind this. So for those of you who have been engaged in the persuasive narratives, these can be very effective as well. They can come up here and bring a voice to some of the work and showcase a story that will help people better understand these issues. We always, one of the things in our office, when as angry as you can get sometimes reading social media posts, we're always asking whoever's reviewing them to strive for compassion. People are doing it for a reason. Even the trolls, they have a need to have an audience. You need to recognize that. You don't need to love them, but you should just understand it. And you don't, again, this goes back to the spitting match, but you don't need to retaliate. If you've made your statement correctly, that's as much as you need to do. Don't keep on trying to restate. It will survive because others will start reading that and they will use your argument and your citations and they'll forward it onto their channels.
Thanks, Mike. And another thing that we want to remind you is how to establish your voice and tone. Every time you talk, you write, when you design, post, respond, launch, thank, and connect with others, you're exercising your voice, and this is a brand voice. You need to find your adjectives to develop the voice and the vibe of your personality. You want to talk, you want to write like you're talking and try to avoid jargon. Jargon tends to turn people's brain off, or it's too much more for them to have to think about. So they don't want to translate, so they might just move on if they have to think about what does this mean. They'll end up clicking somewhere else if you decide, too many acronyms, for instance. And then, like Mike said, write from the reader's perspective. Always think about how to make me into a we, or how to make them more of the hero of your post, as opposed to you. And be clear, so that they will get, they know what they'll get from what you're trying to do. And you want to try to avoid the drama here. You want to avoid the sensational headlines. You always want to be clear over clever. And sometimes I fall into this, but this kind of forces you to have to understand the reader and write more to them as opposed to what you're thinking.
So I think as we look at all this, there's some parting information, and then I'm thrilled that we'll have about 10 minutes for some questions and answers. But if you are going to engage in social media, and I do encourage you to engage, use good judgment. Some questions you should ask yourself is, would CDC or CDPH post this? If so, then it's definitely safe. So think about that. Those are just things you might want to think about. And it's where I think your champion voice is best used. Would a reasonable person understand and appreciate your message without being offended? I don't doubt that any of you guys will never be offensive in that sense. But it's, again, you can get pulled into this rabbit hole. And I want you just to keep some distance from this and remember what you're trying to achieve. It's why it's so important what Muriel said at the very beginning. You need to have a plan. You need to know what you want to achieve, so that you don't get pulled into that rabbit hole, because social media can definitely drag you down in there. And one of the things we always say to all of our colleagues is, if you aren't sure about a post, ask a colleague before you post it. It's just a good way to go hold it. There may be, if you had a second thought about it, it's probably a good idea to get a second read on it before you post out there and put it up there. But again, as we close out this idea of social media, I think Muriel and I very strongly would like to encourage you guys to participate in social media, but to do it at a very wise level, and to use your knowledge and understanding of this issue to help educate people, and to try and break the chain of disinformation that too many others are out there putting out there, so that you can move it forward. We could have a whole conversation about advertising with social media, which is a fascinating topic, but it's a much more complicated, and I don't know if you guys have resources to do that. It's not expensive, but it's a whole different category. But why don't we take a breather here and open it up for any questions that you may have. There's been some great dialogue on the chat. So this gives you a chance to actually ask us right now. Oh, so Madhu, thank you. You're asking exactly the right question. So Madhu's asking, is it okay not to keep responding to each one's comments by clicking or reply? This was somewhat of a problem, and I felt like my time sucked up and thus have left my Facebook page limited. Yes, absolutely. It's not only okay, it's recommended. Your job is not to be this constant. You're not their single resource. You're there to help them understand an issue, provide the background information, and then you can step back. There'll be a whole host of comments. Some of the comments, when you read them, they may grill you. It's like, oh my gosh, are these people, do they still not get it? Don't worry about it. You can over-engage. It's very easy to over-engage in social media. What we want you to do is use your knowledge, your credibility to establish the key piece of information or to correct misinformation, and then step back from it. That's where you're going to have the greatest success.
I think a good thing to note too is that it's very easy to react to social media because it's an emotional reaction. Like you may actually have an emotional response to a post. You may feel offended or you might feel very happy. Sometimes when you see something, take a breath and then respond if you feel a response is needed. A lot of times how people are using it is an emotional response to something, and then it's an easy way to react. I think that an easy way to start practicing the types of suggestions that Mike had given is actually with family. When you share things with family and you react, try to learn how to stop yourself from responding and really thinking about what you want to say and stepping back.
I'm going to respond to Marie. Marie was asking questions about TikTok, and there's a good reason for it. I mean, TikTok is a very popular entertainment social platform right now for youth. These are usually fun little mini YouTubes, if you will. They're 30 seconds long of somebody almost inevitably doing something I find a little ridiculous, but you know, it's entertainment amongst younger populations. What I want to encourage you to do is not get caught up in some of the mediums just because they have the right audience and the right following doesn't mean it's necessarily the right place to advocate for a direction. So, you know, if you're trying to encourage teenagers to brush their teeth, I will tell you, I don't think TikTok is the right place to do it. Yes, they are watching it and it's there, but it's not where people go to be persuaded. It's where people go to be entertained. It's where you go to have some giggles and some laughs. And you've got to question whether that's the right place for you to put your professional credibility or not. And I know what you'd be thinking is probably having another youth do a TikTok post that was cute and fun and clever. But I just want to, again, the audience isn't there for the purpose of education. That doesn't mean you couldn't try and educate them, but it's a lot of work. And it's not where I would suggest that you put your energy. Any other questions? You guys are all set for taking on the world of social media? I'm sorry, I was just reading Sharon's and I got a kick out of Sharon's note here. I joined Facebook in college before it was open to the public. Yes, we all remember those, or a few of us remember those. I stopped actively using it sometime when it became more for my parents' generation. If I wanted to use it professionally now, would you recommend creating a new account? I would. I think it probably makes sense to create a new account. For all of you, you know, you may want to have two Facebook accounts. One is a personal account and one is a professional account, or one is your, let's call it your champion account that's more around advocacy. It keeps you a little bit more protected and shielded. We in our office and with our clients always have secondary accounts for that very purpose. And because it is now your parents' generation, those parents can be very influential and they can be players. So I think jumping in and playing there is probably a good idea. And I do recommend having a second account. Any other questions? What I will then just close out here is just to remind you that this is, I know how scary it is, and if you're frightened of social media, pat yourself on the back. You should be. It's not necessarily a safe place. There are no cops on the street to make sure that people are being responsible, reasonable, and intelligent. It's a place where anybody can come in and say anything and do anything. And that can be really injurious. The other thing, though, that I would tell you as a caveat to that is if somebody were to throw an insult at you, I've had to do this with so many of my clients and say, let me just show you how many people saw that. It was 16. Yes, it was on Facebook with its 1.2 billion, whatever users, but only 16 people are on that stream right now. So don't get so excited about it. But as it came up in the chat with many of you, you guys have found communities out there. Those communities are influencers. They're powerful, and they can be the advocates that you can invite to show up at town hall meetings, to write letters to elected officials or to policymakers, or to take positions on your behalf. So that's important. And then secondly, and this is probably my biggest issue, is there are not enough of you on these platforms correcting bad information. And as a consequence, that bad information is moving like wildfire, because if there's no counter to it, it stands as established fact by too many people just see social media that way. All of you can play a role by every now and then just feeding in a study or some facts or some background that will help people better understand that issue. It will make a difference. It will help people. People are not fools. They know where good information comes from. And when it's cited information, they tend to respect it. And you all have that capacity to do that and to reroute some of these bad conversations that are going south and in the wrong direction, and get people to start to say, okay, hold on. I don't want to follow that troll who's taking me in the wrong direction. I now can count on this physician or this dentist who really knows this stuff. They've corrected me and given me the information I need.
And do you want, I can talk a little bit about that. I see that you're talking about, they want to know about Blogspot and then a little bit of podcast. These are, I think, very time consuming. They have to be very well thought out. They are more of a one-way communication where you're telling someone information, and you have to generate audiences. And unless you already have audiences that you have collected from other social media platforms, it's tough to start one to from the ground up. What you're going to be doing is constantly generating more audience, more eyes, and you may have to use other social media platforms to drive them to your blogs and to your podcast. So that's how a lot of times you'll have to use other platforms to direct them to those other blogs and podcasts. So that's where you want to think about, where do you want to put your energy in, because all of these require a lot of thought, a lot of planning, and the topics have to be well thought out in order for it to be in order for it to reach the audience that you want.
Yeah, I think
it may take like a year or so for you to garner the audience that you're actually looking for.
Yeah, I would totally agree with you. I think Blogspot, your own blog, there's nothing wrong with it, but we call Blogspot, we put that in the category of vanity sites, because most people who are posting their own blogs are posting it for 7 or 8 readers out there, if they're lucky. Instead, what you want to do is jump onto social medias that bring an audience to you, that already have an audience. But like Blogspot, you have to build your own audience. Some people have been able to do this, but it's an entire career in and of itself to do that. I would suggest, if you're going to take the time to write a blog, write it as an op-ed. Go to the op-ed class coming up and write it as an op-ed and put it in a publication where it's really going to have an audience and it's going to have some real power and influence. Podcasts are great, and doing a podcast, if you do a podcast, that's terrific. But think about how you distribute it outside of just the existing social media platforms. Where else can you use it? Can it become part of a curriculum that you're doing? Can it become something that people can view in your waiting rooms? Are there other places that it can be used? Because it's a lot of work to do if it's limited to a single platform that may not take you far. All right, well, thank you, everybody. And hopefully I'm going to see your responses out there. There's going to be a couple of hits that will really grab people and that you will help redirect people.
And these are just some resources that I found helpful if anybody wanted to dive in. If you have, sometimes scheduling scheduling social media posts can be very, very time consuming, and Hootsuite can help you. Canva is a great resource for designing ads where you don't have to think about, and it's free there's a limited free option that helps you to design it, post it, makes things a lot easier. Adobe Spark is a quick video type of thing that makes it very interactive. These are the most approachable ones that I think are very helpful. There's so many more out there, but I just thought I'd give this out as a quick resource. I think a lot of people it's very easy to learn.
Thank you. Thank you both. Thanks so much for tackling a very intimidating topic and breaking it down for everyone, and really providing some very tangible strategies that everyone can take to engage in social media and benefit from what it can provide in terms of leveraging our voices, but also be aware of the challenges as well and avoiding those. We are moving on to our group work. This is our development planning session for the afternoon. And we'd like to start out by giving you 10 minutes to review and complete the worksheet that we have been sending around. You'll find a link in the chat. The goal of this worksheet is to provide an opportunity for you to think through your PSE project at whatever stage you are at right now. So practice providing an overview and description. Think about the challenges and opportunities to advancing your work. What are some examples of partnerships and dissemination opportunities? So after the 10 minutes at 2:20, we'll move you into breakout rooms, and you'll have some time for group work where you will be able to review what you've outlined in your worksheet. So there'll be about 25 minutes, so everyone should have an opportunity to share. And then when we come back as a larger group, we will ask for a volunteer from each group to share one thing that you kind of learned or want to talk about and share with the larger group from your time in the group sessions. So feel free to take this time to work on the worksheet, and let us know if you have any questions. Use the chat. Okay, is everyone back from their groups?
Yes.
Okay, wonderful. So we have just a few minutes, and would love to have a report out from each of the groups. So if you've thought of one person from your group that could maybe share one thing that either was a common thread or just something that really stood out from your discussion and your reflections. I heard some really interesting conversations, and I think it'd be wonderful to share them with a larger group. Does anyone want to go first? And you may not recall your group numbers, but we had group 1. Just trying to remember who was in that group.
Yeah, room 1 was a lot of the folks from LA County, Fresno County. Room 2, I know there is representation from Santa Clara. I know Madhu and Dr. Pindakar were in that room. Room 3, there were some Santa Barbara, Sacramento folks in there. And then in room 4, I know Wakati started in that room, and I'm just blanking on who was in that room. But yeah, I don't know, maybe you can start at the room 1 if they want to give some thoughts.
Sure, I was moderating, so I'm happy to chime in. We had the best group, I can tell you right now, Fresno and Los Angeles. They were brilliant. Honestly, I was so impressed. Work towards addressing issues of food insecurity, especially among farm workers, as well as literacy, nutrition literacy, which I think is going to be fascinating. And then screening for food insecurity in Los Angeles County were areas that they're going to be working in. What was very interesting was where they're trying to move towards. And I think this is a given in the time of COVID, everything has been topsy-turvy. So sustainability seemed to be a strong theme for both groups of how do we sustain and how do we grow what we've actually created right now? In some cases, COVID allowed them to do things that now will they be able to do it post-COVID? And then I thought we got to some of the challenges, and I thought they were the types of things we should all expect to hear. Making sure they get buy-in by their partners and community, engaging businesses, overcoming the digital divide, especially with farm workers and populations, competing needs, and then even some discussion about telehealth and how do we move out of telehealth and back to personal intervention. So some great conversation, some very exciting things going on in both those counties.
Great, wonderful. And how about group 2? Or any other group that wants to share, next group, we can go out of order too.
I can go for group 2. So Mike, I think our group was the best. No, I'm just kidding. We had some great discussion. We had 2 providers, Dr. Raghavan finishing up this year, I think this year's cohort, and then the new cohort, Alexa from the incoming cohort. So both of them discussed their work, and Dr. Raghavan shared, some of the challenges, of course, with COVID. It's sort of thrown a wrench in most people's work with things taking longer than they should. The good news with her is that she's got the funds for the park signage, but things are taking a little longer. And so we discussed, maybe since everybody's using telehealth, during the telehealth visits, maybe using the soft copies of the signage in their waiting rooms. And so that way you can still sort of see them. And so she's going to explore that. And hopefully things will start moving forward. It's always great to have funds available. So Alexa, on the other hand, talked about her project. She wants to work on the food insecurity. She's at Ravenswood, and actually was discussing funding sources and how to go about securing that. And we discussed, of course, we are here in the Bay Area, and there's all these companies who've got lots of money, and how could we tap into that? Dr. Raghavan had a suggestion about sharing, presentations and sort of raising the awareness around it and seeing if that could help. And we discussed about, in San Mateo County having healthcare districts and First 5, and seeing if maybe there's grants available or if those could be explored for funding as well. So it was a good discussion all around.
Thank you. Thanks for sharing. We have 2 other groups.
I can go for group 3. I believe I had Marin County, Santa Barbara, and Sacramento presented there, and they talked a lot. I mean, we had the opportunity to share with 2 new from cohort 4, and they had plans for oral health in Marin. I think it was a pediatric school-based program that they're looking into. And with Sacramento, they're still looking at nutrition access to the community. Unfortunately, they do not have a champion provider, but they're still looking to really look into opening up that type of PSC work. And with Santa Barbara, she had the floor to gain access to the other local health departments to talk about, and hey, do you have any ideas? Because my ideas are so big. I'd like to opportunity to talk to other people and how to break down this big overarching goal into smaller tasks. And she was talking about a lot of park access and developing an app, which was really fascinating. So a lot of planning, a lot of opportunities, definitely. And I'm looking forward to how this is all going to turn out, because I think they're just, it's going to be really cool to see how it all work out.
Thank you, Muriel. That was great. Thanks for sharing. We have one final group. If you have any tidbits to share for the larger group, so group 4. I think we had Sharon, were you in that group? And Marie? Anything you guys want us to bring back to the larger group?
So I just summarized, there were a couple of dentists with us, and then myself, I'm a pediatrician, and our health department partner in San Mateo County was talking about a project that she's doing with a new pediatrician in cohort 4. So it was actually kind of themed. The pediatricians working on some food insecurity things with food pharmacies, but running into challenges, particularly related to, related to COVID and the disruption in partnerships and programs that have gone on. And then also from the dental side, talking about the Rethink Your Drink campaign and how I felt really guilty myself because we've participated in this, but how apparently fruit waters are also really awful for teeth and contributing to tooth decay. And so, you know, from the medical side, they are free from sugars, but we had unknowingly been promoting fruit waters for the last several Rethink Your Drink campaigns. But anyway, that was fantastic, and talking about how to collaborate with the local dental associations, getting buy-in from, having buy-in from the hygienists, but not the dentists, and overall coalition building.
Great. Thanks for sharing. So we are at the end of the training, but we do want to take a few minutes for a couple of acknowledgements and announcements. I do want to actually first acknowledge Karma Okaberg, who is here with us. Karma, thanks for being at the meeting and attending. Karma works at CDPH, and she is our partner and supervises the Champion Provider Fellowship on the CDPH side, and we're very grateful for having her champion our efforts and for all the support she's been providing. So thanks for being here, Karma.
Oh, thank you so much for mentioning it. I really appreciated participating.
And we would also like to acknowledge cohort 3. Cohort 3 is graduating from the Champion Provider Fellowship. And we just want to acknowledge all of your accomplishments from your initial onboarding in San Francisco in April 2019. You all have accomplished a lot, and you continue to move forward efforts to create healthier communities. Over the course of the fellowship, we have had fellows report impressive activities in all of our 5 focus areas. And we're very proud of all of the work that you have done, despite the challenges presented by the COVID pandemic and the impact that it's undoubtedly had on your work. This cohort has continued to engage in activities that have really been critical to community change. I'll also point out that there's been tremendous success with media, lending their voices and expertise to addressing key issues affecting community access to healthy food and beverages and physical activity. We want to commend all of you for your accomplishments. It has been our pleasure and privilege to work with you over these past 2 years. We look forward to continuing the partnership. As you may have noticed from the alumni representation at today's meeting, once a fellow, always a fellow, so please keep in touch. I also want to remind you to look out for a final activity report that will be released on Monday. We'd appreciate all of you responding to that so that we can continue to capture your important work. And thank you again for being part of this program and all that you've contributed to it. finally, the evaluation information. So you should have received an evaluation email link around 2:30. It's a Qualtrics link, and if you didn't see that, please look to the chat where we've also provided the link. You'll receive information for CME and CDE units once you complete the evaluation. Please remember to check our Champion Provider Fellowship website for information about all of these wonderful upcoming events that we hope to see you at, including the op-ed project that we hope you all sign up for. Thank you to all of our speakers and participants. We covered a lot today, from the work in progress sessions to the strategies for building resilience and maintaining well-being, leveraging social media, and action planning. I hope you have a great rest of the afternoon, and we look forward to seeing you at upcoming events. Thank you, everyone.